Good morning, everyone. Welcome to the special board meeting of Placer County Board of Supervisors, Tuesday, May 26th. We will begin with a flag salute led by Supervisor Holmes.
I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, thank you. We are going to begin with an update from our county executive, our CEO. And just as a reminder for people who are watching online, we will take public comment for each individual item. And with that, Todd?
Okay, so really wanted to give a quick update. We've obviously have moved into moving forward with automation of our and modifications that we have with our current county operations. So we have buildings that are starting to come online. We'll be posting some of those items here as we move forward in the coming weeks. We have folks and employees that are starting to come back into the office. So I will leave it at that. What I'd like to do is give a quick update around COVID. So Dr. Sisson, I believe, is on the line. What I'd like to do is maybe turn over to her and she can talk about kind of the current status of where we're at to date.
Super, thank you very much, appreciate it. Good morning, Dr. Sisson. Thank you for joining us this morning, appreciate it. I know you worked over the weekend, so I appreciate you being here this morning as well.
Sure, happy to be here. I appreciate the opportunity to provide an update on the coronavirus pandemic. And I'd like to update you this morning on the number of cases, testing, contact tracing, and my efforts to advocate on behalf of Placer County to the state. Before I do that, however, I want to extend my gratitude to the myriad partners who have supported Placer County Public Health's COVID-19 response over the past several months, beginning with our healthcare partners, including hospitals and clinics who are treating and testing for coronavirus every day. As the county reopens, the Reopen Placer team, Placer cities and town, and local chambers of commerce have played a critical role in developing and disseminating guidance for businesses about safely reopening. And of course, Placer Valley Tourism and the North Tahoe Public Utility District, who are graciously hosting testing sites. I also want to thank several hotels in the county, along with the Gold Country Fairgrounds in Auburn, for their support in housing high-risk, exposed, and COVID-positive persons experiencing homelessness. I'm also grateful that the state of California has provided Placer County with 2 large-scale testing sites free of charge, a contact tracing academy, and a technological platform for contact tracing. I last formally addressed this board on May 11th, at which time you approved Placer County's attestation for a stage 2 variance from the California Department of Public Health. The following evening, May 12th, Placer County became among the first 4 counties in the state to have its variance granted. Placer County was able to advance fully into stage 2, reopening restaurants for sit-down dining, stores for in-store shopping, childcare to all workers, and limited personal services like car washes and pet grooming. Businesses are required to develop site-specific safety plans and follow detailed state guidance. Reopening in Placer County didn't begin in earnest until May 13th, and some businesses, like the Roseville Galleria, did not open until late last week. Since my last update to this board, laboratory-confirmed cases of COVID-19 have increased from 170 to 188. Which represents an 11% increase over the last 2 weeks. On Thursday, May 21st, 8 new cases of COVID-19 were reported to Placer County Public Health. This is the largest daily case total since the nursing home outbreak on May 2nd. Prior to that, the last day with 8 or more cases occurred on April 7th. Since the 1-day increase last Thursday, however, we have seen numbers more typical of recent weeks, with 4 additional new cases reported. Hospitalizations in Placer County for COVID-19 remain well below hospital capacity, yet they have increased slightly. Hospitalizations have climbed from 1 confirmed case of COVID-19 in Placer's 3 hospitals to 7 cases as of this morning. Last Wednesday, a 9th resident of Placer County died of COVID-19. This person was an elderly resident of the Auburn skilled nursing facility that has been experiencing an outbreak of coronavirus over the last few weeks. This death, while not unexpected, is a tragic and sobering reminder of how important it is to protect the most vulnerable among us from COVID-19. To that end, I'm pleased to share that Placer County Public Health's plan to routinely test residents and staff in all 10 skilled nursing facilities in the county was implemented today and will continue indefinitely. Neither cases, hospitalizations, nor deaths have reached the triggers for restricting reopening that were published in the approved attestation, yet public health will continue to watch the numbers closely. Speaking of watching the numbers, I want to encourage the board and members of the public to visit the updated data dashboard at placer.ca.gov/coronavirus. Last week, we began reporting numbers of recovered cases as well as cases by zip code. When I first discussed the concept of gradual reopening with this board on April 21st, I pointed out that it would take several weeks to see the impact of reopening on cases and hospitalizations. This delay is a result of the incubation period of the virus, which can be as long as 2 weeks, along with the time it takes for someone to seek testing and then receive results, and the additional time it takes for people to get sick enough to require hospitalization. Less than 1 incubation period of coronavirus has passed since Placer's stage 2 reopening began in earnest on May 13th. It is too soon to tell whether Placer will see a resurgence of cases due to stage 2 reopening. Shifting gears, I'd like to provide an update on testing and contact tracing. The 2 large-scale testing sites run by OptumServe and sponsored by the state continue to operate in Roseville and Kings Beach. The Roseville site is operating around 80% of capacity, and the state has offered additional capacity if needed. However, the Kings Beach site has been testing only 20 or so of the 132 possible people each day, and we're working with the state and with Nevada County to identify another North Lake Tahoe location that might be better accessible. We are also seeking a new location for the Roseville site so as to not overstay the generous welcome provided by At the Grounds. We will keep the board and public updated once new sites and start dates are confirmed. As a reminder, these 2 sites offer testing free of charge and test people with and without symptoms. OptumServe takes signups over the internet or by phone, and the website is now available in Spanish. In terms of testing volume, in the past 2 weeks, an average of 247 new PCR tests were performed daily. The most tests conducted in one day was 350 on Thursday, May 21st. In regard to contact tracing, the California Department of Public Health has opened up its 20-hour online contact tracing academy to local health departments. Last week, approximately 40 redirected Placer County employees completed this training. These newly trained employees are now available to help find contacts of new cases to slow the spread of COVID-19, although none have been deployed just yet. At present, Placer County is able to quickly trace contacts of newly identified cases using its core public health staff. Finally, I want to say a few words about my advocacy efforts on behalf of Placer County to the state. I participate at least weekly in calls with leaders of the California Department of Public Health. On last week's calls, I advocated to allow reopening of church services with modifications, including outdoor services. I was pleased to see the state support such modified church reopenings in the guidance released yesterday. I have also been and will continue to advocate that the state base reopening decisions on risk, not essential versus non-essential, and to apply logic consistently across business sectors and other activities. In summary, coronavirus is still active in Placer County. This is evidenced by increasing numbers of new cases and hospitalizations over the last week. Public health will be watching the case and hospitalization data closely over the next 2 weeks to see the impacts of the stage 2 reopening that began on May 13th. Should a surge in cases result from reopening, we are well prepared with adequate testing capacity and adequate contact tracing capacity to address that surge. Thank you for your time and attention, and I'd be happy to answer any questions you may have.
Thank you, Dr. Sisson. Appreciate the update. Let's see, Supervisor Holmes, you have some questions?
Thank you, Dr. Sisson. I appreciate your dedication to this issue. Is there any, do you have any understanding of some of these folks, the 9 that have passed away because of the COVID-19? Did they have any underlying conditions that may have weakened their immune system that would be more susceptible to COVID-19?
Yes, all 9 of the deceased cases had underlying medical conditions that put them at risk for severe disease from COVID-19.
Okay, that's what I figured. Thank you.
Supervisor Euler, questions?
Yes, thank you. Morning, Doctor. A couple of questions. First of all, in regard to the House of Worship ruling, my understanding is that the governor has said 25% capacity up to 100 people. Is that correct?
That is correct.
Okay. And I'm wondering what we can, I'm sorry, were you going to add something?
Oh, I was just going to say that will be reevaluated in 3 weeks to determine if the number can be increased. But that is the starting point for capacity.
All right. Well, on those lines, having been on multiple occasions over the last 2 months in Home Depot and Walmart where there were well over 100 people in there, what I'm wondering is, can we, I don't know if pushback is too strong a word, but the 100 limit seems incredibly arbitrary when we start talking about some of our houses of worship like Bayside and Granite Bay and Adventure Bayside out in Rockland. Bayside and Granite Bay, just in the main sanctuary, they have a seating capacity of 2,000 people. You could accommodate 100 people on half of the floor area, perfectly socially distanced, and never even get into any of the arena seats or anything like that. Heck, you could accommodate 100 people properly socially distanced in their overflow area, the video cafe. So I'm just, they simply, a church like that is simply not going to open up when 100 people represents less than 5% of their capacity. They're not going to go and do the kinds of services they do and spend the kind of money they spend on their services when they can only accommodate, by reason of this edict, 100 people. So it would be, I think, extremely helpful. I don't know if you've ever been on Bayside's campus, but I'd be more than happy to arrange for you to get a tour of their campus, see their facility, see the size and scope of how they can accommodate people very safely and possibly move forward. I mean, they when I spoke with them actually late last night, the senior management team there at Bayside, they were more than happy with the 25%. They thought that was a fine start, but the obviously the 100 is the sticking point. So if you're so inclined, would you be interested in me arranging a little tour of their facility so you can get a kind of a idea for yourself?
Yeah, absolutely. I'd be happy to tour the facility and to speak on behalf of some of our larger churches to the state. A couple points that I wanted to make in response to your comment, however, I appreciate the the comparison with Home Depot, and I guess what I would point out in terms of a difference there is the duration of time that's typically spent in the environment. So when we look at risk, it's the intensity of contact as well as the number of contacts. So and intensity of contact is a function of the distance as well as time. So a trip to Home Depot typically lasts several minutes, maybe up to a half
I
hour.
invite you to come to Home Depot with me.
Sorry, hang on 1 second. We got some background noise. So, church service is a minimum of an hour. So you have increased risk of exposure from the time period. But I do appreciate, the concern that, large numbers of people are in some of our retail spaces. But again, I think the difference is duration. The other piece that I want to point out, and I don't want to speak for the state. Clearly, this is a state decision, not a local decision. But having been on calls where reopening of churches and other businesses and activities is discussed, one of the concerns about large gatherings is just the large number of people that have the potential to be infected if there is simply one symptomatic or even one asymptomatic carrier in an environment with a large number of people. But beyond that, and just the concern for the spread of disease, is also the ability of public health to do contact tracing quickly enough in the case of a spreading event in a church. Let's say there were 500 or 1,000 people present, even with our ramped up contact tracing capacity of about 60 people right now. I would be highly concerned that would, having to quickly trace contacts and arrange testing for 1,000 people would overwhelm our ability and very quickly result in additional cases spreading and getting the outbreak getting out of hand. So those are some of my concerns about reopening larger churches, but I do appreciate that the number 100 is very small for a large church that has much more significant capacity.
Okay. And then on the issue, as a number of us have heard extensively over the weekend about youth sports and getting our kids out and playing in their organized sports, this may be a more relevant conversation for our next item on the stage 3 stuff, or is this, I'm not really sure where, but clearly we've heard loudly and clearly, I believe that the data is fairly conclusive at this point that youth are largely untouched and unaffected by this thing, and yet they are being, in numerous cases, traumatized by having their lives completely turned upside down and being forced into a pattern of existence that is anathema to what it means to be young.
Yeah, I appreciate that comment, and certainly, I have heard loud and clear, as have you, from the public over the last week about their concerns about closing youth sports, which again, I want to be clear that this is a decision made by the state health officer and director of the California Department of Public Health, Dr. Sonia Angel. This is not a decision made by the local health department. And as I've pointed out multiple times to this board, counties can have stricter requirements than the state, but they can't have any looser requirements. So the state has made it very clear on their frequently asked questions, which have the weight of law, because they are included and referenced in the state health officer's order, that only certain types of outdoor recreation is allowed at this time during stage 2, and that outdoor recreation must be people must maintain 6 foot of distancing and not gather with people outside their households. I then followed up with a specific email inquiry to the California Department of Public Health asking about youth sports, in particular practices. And they clarified that indeed youth sports practices among non-household members are not allowed during stage 2. So, I'm simply the messenger here, but I want to say that I absolutely, hear your concerns and those of the public, and I appreciate that there are unintended consequences of stay-at-home orders on children as well as adults in terms of mental and physical health. And, I think we are all trying to balance risks. One thing I do want to point out, you mentioned at the beginning of your comment that children are by and large untouched and unaffected by COVID-19. And what I will say is certainly in Placer County, the numbers of cases among children have been very low. I think, we have 1 or 2 cases of people under 18 listed on our website right now. So, but I do want to point out that in some cases, the consequences of infection, and we do believe that many cases in children go undetected. So it will be interesting if Placer County does indeed do a seroprevalence study to see what the seroprevalence is in children. But what we have seen in other countries as well as in parts of the US that have had more cases in children and more cases overall are some very concerning new sets of symptoms. In fact, the CDC released a health alert just last week about a multi-system inflammatory syndrome in children that is similar to Kawasaki's disease and has had many children who've in fact, even recovered or seemingly recovered from COVID-19 infection or never even had symptoms, then develop very severe inflammatory disease requiring hospitalization in intensive care units. So, I would just caution that there's a lot that we still have to learn about the virus that causes COVID-19, and especially when it comes to children.
Okay, thank you.
Thank you. Supervisor Gustafson?
Good morning, Dr. Sisson, and again, our gratitude to you for your leadership and efforts during this pandemic. I had a couple questions. So, on the new cases, now that we have contact tracing, are we getting more information now? Were these individuals just went for tests, or were they already symptomatic? Did they already have some sense they had the disease, or were they being tested for other reasons?
Yeah, so my understanding from discussing the initial contact tracing and case investigations with our epidemiology and public health nursing team here with the county is that of those 8 cases that were identified in that one day on last Thursday, which was reported on Friday, 3 are members of the same household and 2 are members of another household. 7 of the 8 cases were symptomatic. They were all tested through their regular healthcare providers. None of them were tested through our OptumServe sites. I believe that at least one of the cases is in somebody who works in an adult or a long-term care facility. So that's something that we're following up on. But I do not believe we've determined the source of infection yet in the other cases.
Yeah, thank you. I appreciate understanding more of the magnitude of where this community spread was occurring and what may have been the cases. So we are checking, have they traveled, what their exposure potential was, so that we understand better that risk factor as we evaluate other situations. And then I appreciate your advocacy with the state on some of, really basing this on risk. As we learn more, we know more, we can identify and inform our public better as to what situations are going to be problematic for them as individuals and business owners as they move forward. And I continue to want to understand more about that transmission potential, as we all do, so that we can make really well-informed decisions. And then finally, I think I was somewhat surprised yesterday with the governor's announcements, because I thought we were going to hear more about other types of businesses that might be moved into stage 2, the personal care, the gyms, some of the other issues. For some reason, I thought on Friday's press release, we were going to hear more Monday that was potentially going to open up some of those other sorts of businesses and give them a path for reopening as well. Was that a surprise to you, or were you aware of that?
So my understanding is that you can expect another announcement from the governor probably later today about resumption of some other personal services, including hair salons and barber shops.
Okay, and then finally, and I know we're going to get into this in our next resolution, but also over the weekend, somebody provided me the graphic that now looks like most lodging for non-essential purposes has been moved into stage 4. Is that your understanding?
That is not my understanding. I thought that was part of stage 3, although the state's website is not entirely clear at the moment. It mixes stage 3 and 4 in a table to show what can happen now and has to wait. But yes, my understanding is that was a stage 3 activity. So I'd be happy to follow up with the state if you share that graphic with me.
Sure, thank you. And then finally, on the Kings Beach facility, I know we're not seeing the numbers of testing we'd like to see there. And part of the great news about that location is it does serve a very transit-dependent or pedestrian-dependent community there versus moving elsewhere. But I am concerned with the numbers. Many local businesses and other individuals have said, well, gee, I'm not symptomatic. Why would I go get tested? I haven't been, exposed that I know of. So I think there's a concern from the public. Do we just keep going and getting tested and using these services? So maybe you could help us explain that. Should they go even if they're not symptomatic?
Yeah, as I said in my update, people can get tested whether they have symptoms or not, and many infections are in fact asymptomatic. So I would encourage people who have been rather active in the community, perhaps because they're essential workers or even healthcare workers, that they would get tested, even if they do not have symptoms, so that they could learn whether they are indeed an asymptomatic carrier. That is certainly a valid reason for testing, and it does allow you to just any level of concern that you could have been exposed to COVID-19 is a reason to go ahead and get tested at the OptumServe site. And Supervisor Gustafson, just coming back to what you said about the transit-dependent nature of the Kings Beach community, that's certainly one of the reasons why we cited the testing facility in Kings Beach in the first place, and certainly something that we would be looking for an alternate solution if the testing site does move from Kings Beach. But essentially we've been put on notice by the state that if the testing numbers don't increase in the next few days, that they will essentially potentially take away the site. So that's why we are looking for a new location, but we're very much committed to continuing testing capability in the Tahoe area. And certainly should we move the site out of Kings Beach, I would be talking with our transit partners to figure out what sort of public transportation or subsidized transportation options would be available, particularly for asymptomatic people who are seeking testing. We obviously don't want symptomatic people getting on public transit. That's actually not allowed at this time, but trying to help people arrange transit to a testing site. So I absolutely share your concerns about the Kings Beach community.
Well, and then I might wrap up with just what can the county PIO staff do or others to help us promote this to our other partners and through the community house program to some of our undocumented folks in the Kings Beach area, and make sure that they're aware that there isn't an issue for them to go get tested, no cost, and encouragement, given some of the numbers we've seen out of other counties on those population impacted by population numbers, let's see what we can do to push more outreach and safety with those.
Yeah, we'll do some
Availability.
social media outreach, and I think public health has done quite a bit in this space as well.
Okay, great.
Yeah, absolutely. And, I'll say that, the website was not available in Spanish until I believe yesterday or over the weekend. So, people who were primarily Spanish speaking were only able to sign up over the phone, which is a more time consuming process. So we really are hopeful with the addition of the Spanish language website through OptumServe that's going to help outreach to the primary Spanish speaking population. But I agree that specific outreach to undocumented, there's no concern from an immigration perspective about this testing would be important.
Yeah, our Boys and Girls Club and our schools, all the people providing meals in that community would also be a great outreach mechanism. Thank you.
Thank you. Supervisor Holmes?
Thank you again, Dr. Sisson. In your discussions with the other health officers, public health officers throughout the state, do they have any sense of the anticipation of moving into phase 3 or stage 3? Do they have any idea how soon we may be able to, or will that be maybe that'll be announced this afternoon?
So the state really hasn't provided a timeline to the local health officers about movement into stage 3. All of our conversations about reopening churches, about reopening certain personal services have been in the context of activities and businesses that were previously in stage 3 moving into stage 2. So, I would not interpret, for example, should the governor announce today that hair salons and barbershops can reopen, that is not the state moving into stage 3. That's taking those personal services and moving them into stage 2. So again, no timeline has been provided by the state for movement into stage 3. Nor a process of how that would be done, whether it's statewide or through a variance process.
So with your advocation with the state, I think it would be appropriate to open up the fitness centers. I mean, these people are pretty healthy. All the fitness centers have done what they need to do for social distancing and testing. So anyhow, I would just appreciate that. Thank you.
Okay. All right, thank you. It looks like there are no other questions from board members. We want to open this up to the public, but we're having a problem, which is the live stream is 7 minutes behind. And unstable, which I apologize for. So that being said, people can call in via Zoom and get on the Zoom call for public comment.
We can't accommodate public comment on it, but we can accommodate the live stream view on the Zoom call. We can work to switch that and allow public comment on it, but it would take us a little bit behind the scene.
All right, so, and this is 7 minutes behind, so in 7 minutes, y'all will find out that you can get on Zoom, which is not helpful. Okay, and so probably, let's start with, do we actually have public comment for this item? All right, so folks, we apologize for this delay. We're going to do the best we can to accommodate people's public comment. Know that you are also able to send emails about public comment, and we have received a lot of public comment via email over this past weekend, which we appreciate, and we have all received copies of those comments that were sent over the weekend and through this morning. So with that, we're going to go ahead and take public comment on this first item, and we'll move forward with that. And remember, if you need to log on and can't hear it online, you can check the Zoom online as well. All right, and Zoom is working well, which is terrific. We've got 110 people on the Zoom call, so that's helpful. We will begin with public comment. Go ahead, please.
Good morning, please state your name for the record. Hi, this is Julia Sweeney.
Go ahead, Julia.
Hi, thank you all for being here again and for your continued service to our community to keep us safe and help us reopen our community safely. Just a quick comment about the 7-minute delay. I don't know if you could even consider doing a Facebook Live. I know you guys are all on social media, and that might be a nice way to get people seeing the live feed a bit easier than Zoom. So just throwing that out there before I give my comment. And sorry if some of my questions were answered and I missed it. Okay, so I wanted to actually use this time to throw out some questions for Dr. Sisson. Dr. Sisson, I so appreciate all that you are doing and all the information coming out from your team. I especially appreciated the adding of zip code data last week. So it's really helpful to see where our cases are most aggregated and see how we can guide our decisions based on that. A couple questions I had based on the dashboard. I would love to understand why sometimes there is a negative number of confirmed cases on the daily update. So just to give an example, on May 23rd, it said that there was 185 confirmed. And then on May 24th, there were 184. And so I just would love to understand what kind of error is leading to that. Is that a false positive? Are we seeing a lot of false positives? Are we seeing a lot of false negatives? So if you could spend some time talking about, the margin of error on our testing. And that leads me to my next question about suspected cases versus confirmed cases in our hospitals. Especially when thinking about what are some of the areas that could trigger our community to have to move back to a previous phase. I just want to make sure that our numbers don't trigger more lockdowns for our community. So if you could talk us through what caused the spike in suspected cases last week and then that dramatic drop down like 39 cases over the weekend. And if you could talk us through what the protocol is for determining whether a patient with symptoms of COVID-19 is no longer a person under investigation. I think that just more information about our hospitalizations, how we are treating those people, would be helpful because in terms of PPE, rooms, resources, a suspected case will be treated with the same precautions as a confirmed case. So I think it's helpful to know both numbers and understand what the discrepancy is. And then just if you could also weigh in if our hospitals are going to be reporting any indications of that inflammatory disease. Is that something that you are monitoring as we talk about opening up youth programs? Because I know all of us want to make sure our kids are safe, especially. So thank you so much for all that you are doing, and I hope that the feedback, we've got less than 7 minutes soon. Thanks so much.
Thank you, Julia. And just a reminder for folks, we really want you to keep your comments to 3 minutes, and I'm going to specifically ask our clerk to let you know when 3 minutes is up because we want people to have the time to give your input, but we needed to have it shorter than longer. We appreciate it. Go ahead, please.
Good morning. Please state your name for the record.
Ray Mayer.
Go ahead, please.
Hi, so am I live or am I recording this?
You're live.
Oh, okay, great. So I am a owner of a property around Tahoe. I'm a short-term rental owner, and the current policy right now of limiting short-term rentals is a concern for me. The CDC has stated that the primary spread of the virus is really through person-to-person contact, typically over a prolonged period of time. And they also said that risk of exposure through services is fairly limited. So given that we have a lot of tourists coming into the area already, it doesn't seem appropriate for me to limit or discriminate against short-term rental owners. I know we are following the short-term rental guidelines or the lodging guidelines from the state. But I'm hoping that we can advocate or go our own way as a county to allow short-term rentals to move forward as soon as possible. Given that it really won't limit the number of people coming into the area, and relative to other businesses that have been opened up already, it's a relatively low-risk business. So I'd like to get the board's comment on that.
Thank you for your call. We appreciate it. Next caller, please.
We can now take public comment.
All right, and we can now take public comment via Zoom. That is helpful, so you are all aware you can take comment via Zoom.
Good morning. Please state your name for the record.
Yes, I'm Catherine Curtis. I live in Lincoln for over 20 years. I wasn't going to call in on this, but after just looking at my screen and not seeing anything for 7 minutes, I thought I'd better call to let the board know that there was a problem with the video. But anyway, since I was on the line, I saw you all do your flag salute in the middle of Dr. Sassone's update. There was some questions and concerns about kids. Well, the Lincoln graduating class of 2020, a couple weeks ago, got together. Parents decided they needed to have a school picture. I made the front page of the newspaper, too. I showed it to my son, who works in a grocery store. His comment was, they're not wearing masks. And I don't know, maybe you aren't aware that at the Capitol protest, thousands of people at the Capitol protest, well, they're busing people up from Southern California and out of state. Do you think they are wearing masks on those long drives on the bus? I sure hope that they're getting the names and numbers of everyone else. So when the tracers call them to tell them that they've been exposed, they'll know who they've been in contact with and make it easier on the tracers. Maybe save us some money. I am concerned about what's going on. I've been staying home because my son works at the grocery store. So when I do have to go out, I do wear a mask to prevent from contaminating other people just in case. I had a test. I waited 2 days before it was open to everybody. But I did it because I wanted the county to reopen. Not because I was afraid for myself, because my son had just had a test and he was negative. But he had been sick for a couple weeks with a cough. Shortly after, his distribution point had a death. So, yeah, let's open up. I'm glad Dr. Sassoon is helping to figure out where we can go safely and open up safely. I understand that a lot of people are having a hard time. I'm having a hard time thinking about Ruth Tapanock's family. And if you don't know who she is, she's one of those Placer County residents that died of COVID-19 at Kaiser Hospital. Thank you.
Thank you for your call. Next comment, please.
Good morning. Please state your name for the record.
Good morning, Lisa Larkin.
Go ahead.
First, I want to thank Dr. Sisson for all of her work. I do want to say that I'm very dismayed that on an agenda last week for a meeting that ended up being canceled, that they were going to take a vote on rescinding Dr. Sisson's authority as public health officer. I'm glad to see that that meeting was canceled. I recognize that she is the person in the room with the medical background and experience, and I trust her to be patient, listen to the science, and move forward with caution, and follow the state orders. I would be completely against removing her authority. This pandemic is not over, and let me be clear, I understand that small businesses need to reopen, but they need to do it in a safe manner, in phases, so that we have a chance to see the spread a few weeks down the road. And they need to continue those recommendations. And if you've been out and about in our town, you will see that nobody is paying attention to these rules. I've been in a couple of stores where masks were not being worn by employees, and the majority of the public not wearing masks and not physical distancing. So I just want to make these comments clear that I realize that everyone is hurting, and as well as children. I understand they're struggling with staying at home. I have several in my cul-de-sac. But their health and their family's health is at risk, and staying alive is much more important than any sporting event. Everyone is struggling with this issue, and if we don't do something now to make it a mandate for people to wear masks when they go out, especially at essential services and businesses, it's going to continue to surge in this area, and we will at some point be unable to stop it. Those are my comments. Thank you very much, Dr. Sisson. I appreciate you more than you could ever know.
Thank you. Next caller, please.
Good morning. Please state your name for the record.
Matt Johnson. I'm a resident of the 5th Supervisorial District, 95602. I was kind of shocked to hear Dr. Sisson, for whom I have the most high respect, when asked by Chairman Gore, state that the county website was only made available in Spanish this last weekend. Because so many Latino and Latina frontline workers, residents of our county, are in high danger of contracting this. I find it amazing that you're considering pushing the state to move us into stage 3 when you've only, as of today, made information available to that most at-risk community. I commend my supervisor and Supervisor Holmes for wearing masks. I condemn the other 3 supervisors there for putting political pandering over public health. I'm a small business owner, service business owner. I'm 65 years old. When I began to return to servicing pianos in private homes, schools, and churches, possibly in July, I'll be taking precautions, including only visiting one location a day, so I don't cross-contaminate homes, possibly, wearing a mask, washing down the piano keys with disinfectant before and after tuning the pianos, and asking the piano owners to maintain social distance. Yeah, I'd like to return to work and not have to rely on unemployment insurance. But I think that the action that's being proposed today is probably going to make that impossible. So I think you're acting with haste, and I don't think you have all the ducks in the row to ask for what you're asking for. And I would encourage you to not pass this resolution, to consider adoption of a resolution requesting the governor to accelerate commencement to stage 3. We're not ready, and obviously 3 of the supervisors there aren't ready. Thank you.
Thank you. Next caller, please.
Good morning. Please state your name for the record.
Hi, this is Dr. Katie Carlson. I'm a pediatrician and 30-year resident of Placer County, and I have some serious concerns about the COVID reopening process. I feel like our county really shows, as I've seen in the last few weeks, shows some issues with following guidelines in general. I want us to go slowly through this phased process. I've seen cases that have shown transmission in the community and lack of social distancing in the community and lack of mask wearing in the community, despite Dr. Amy Sisson's amazing work these last few months. Our county has an ability to keep going down that path, but I do feel as if we are at a crossroads. And if we don't slow down and use science instead of our want basically to reopen, we need to do this carefully because we will see increasing cases. And as a pediatrician, I am seeing more and more in the country this multi-system inflammatory condition of children that is truly life-threatening for children, although so far they've been able to treat most children as if they have Kawasaki's and they use the same treatment for it. Most are recovering, but it is a serious illness with long-term consequences. And we don't know much about it yet. It's too early. And we need to go slowly. I can't say this enough, and I really, really hope the Board of Supervisors takes to heart the comments I've heard so far along these lines, and Dr. Sisson, who is a very, very amazing individual in this work. So please go slowly, please use science, and that is my comment. Thank you.
Thank you. Next caller, please.
Good morning. Please state your name for the record.
Hi, my name is Cheryl Berkema, Placer County resident. I, too, want to thank Dr. Sisson for her amazing, amazing work. I think she's very well positioned in the county, and her partnership with multiple agencies is just very commendable. I can tell with her language she's in a difficult position. The county seems to be pushing at a much different trajectory and speed, and I think that her attestations, for example, for stage 2, to be able to, within a matter of a few days, to be able to certify, means that she can do the work up front, and she has been doing it. And I'm very, very concerned with the, as several other callers have mentioned, the migration of people. For example, when you open up larger venues, if Placer County is ahead of Sacramento, and Sacramento can't open restaurants, are people going to just bring more of that type of issue here? And I had a question I was hoping that Dr. Sisson could answer, which was her advocacy to the state to base opening on risk, not essential and non-essential. And my question is, it would appear that the stages have guidelines and the attestations to meet those guidelines already incorporate that level of risk. So an example would be hair salons, churches, gyms. The riskier environments have been placed already outside of where early opening. So you advance as you can. But so my concerns are that migrating when you have different stages with different bordering cities. And also I had a question for her on testing. On the contact testing, I believe someone had mentioned about the Lincoln School. Is there an active way to go out and when you see high-risk situations, to test people? And also I had a question on random testing. It would seem like that would be a way to figure out more who is potentially at risk by looking at a random community. Thank you very much.
Thank you. Next caller, please.
Good morning. Please state your name for the record.
Yes, my name is Kathleen Crawford, and I'm a resident in District 1 for Supervisor Gore. Thank you for the opportunity to speak this morning. I very much appreciated Dr. Sisson's presentation. However, you need to know that the video transmittal is probably closing in now on 10 minutes behind because Dr. Sisson is currently replying to Supervisor Gustafson's comments. So it's very disconcerting to try to be following the oral on the telephone line and present the information to the board in current time when the video transmittal is so far behind. I would like to say that I am in support of moving ahead slowly, that we have not had sufficient data from our full opening of phase 2. In fact, we've only had 4 days of the Galleria being open. We're bringing people into this county, and we really don't know what the consequences will be 3 to 4 weeks down the line. So I urge you to proceed cautiously, listen to the science and the doctors, and I will say that one potential feedback we could give to the state of California is that the size for churches should be reexamined. I think we can bring that to them and ask them to reevaluate based on occupancy. But I don't think that we should be trying to move quickly into phase 3, and we can petition the state government to revisit this maximum capacity of 100 people. And I know that this impacts a number of the large churches, including some of the larger Catholic churches here in the county. Thank you.
Thank you. Next caller, please. And just as a reminder for folks, since the video delay is delayed, or the video is delayed, you can call in on the Zoom number, which will give you automatic access, as well as we're now live via Facebook, so you can also log in via Facebook.
Good morning. Please state your name for the record.
Erin O'Brien, and I'm a resident of 28 years in District 5 with Cindy Gustafson, and I have a few concerns. Here in North Lake Tahoe, I'm a general manager of a resort on Lake Tahoe, and we're following all the rules and protocol as far as not renting unless it's to an essential worker. I know for a fact that there are other property owners and large corporations that are actively renting units to non-essential workers. And there's also restaurants that aren't practicing the social distancing guidelines. And I'm just wondering who's enforcing it and why is it not being enforced? I did report that the Welk Resort at North Star is actively renting online, and I called there and was able to book a room as a non-essential worker. I'm in full support of moving forward. I, for one, really would love to get my resort back open and running, generating revenue for myself and paying our TOT tax. But I just don't think it's fair that some of us are playing by the rules and others aren't. And it's not a safe environment quite yet. And also, it's just not fair that there's so many people that are suffering and others that are benefiting from this. So I'd like to see something being done with that. But I'd also like to say thank you for all the work that you're doing and all the doctors. So that's my only comment.
Thank you for your call. Next caller, please.
We're going to shift to Zoom.
All right, we'll shift to Zoom now, so we'll take the calls via Zoom.
Stephanie, please unmute your mic and give your comments.
You might need to say it again.
There she goes. Go ahead, Stephanie.
We can't hear her.
We'll go to Sonia Kupler. Sonia, unmute your mic and begin to speak.
Good morning. I'd like to ask Dr. Sisson to speak to the deaths of despair that has resulted from the isolation and unemployment that people have experienced through the lockdown of coronavirus.
Thank you. Do you have any other comments? Because we'll take all questions at the end.
No, that's all.
All right,
Thank
thank you very much. Our next Zoom caller.
No more on Zoom.
All right, we didn't want to try Stephanie again.
We can try her one more time.
I don't know, just I want to give her a shot if she was trying.
Stephanie, go ahead and unmute your mic.
And if not, that's okay. All right.
We have one more. Tiffany Coleman, go ahead and unmute your mic. give your comments?
Yes, thank you. My name is Tiffany Coleman, and I live in Roseville. And I just I'm calling in to just express my support for the board in their resolution today requesting the acceleration to stage 3 for Placer County and the release of the CARES funding. I really appreciate all the action that the board has done in representing the needs and the desires of Placer County. We really need our community members to have employment, and we need our economy to be robust. And our local health data does not support continued strict measures. I believe Governor Newsom's autocratic control is in opposition to our representative government. He continues to act not according to what our representatives are saying or even asking for input from our representatives, but on his own. And I feel that this is very dangerous for us. So I appreciate all that you're doing. We look to you as our locally elected officials to protect our community and stand for our liberty. And I am definitely in favor of opening up our community. Thank you.
Thank you. And next caller, and remember, folks, we're still talking about our first item, which is item 1A. So any other comments on 1A?
We have callers online. Good morning. Please state your name for the record.
My name is Frank Fagundes.
Go ahead, please.
Yes, how you doing, guys? First, I want to say thank you for fighting so hard to get our businesses open. It made a big difference. Made a huge difference up here in the Auburn community. I happen to have 3 kids at Del Oro High School, and we play in the youth leagues. And my kids have been sitting at home for 2.5 months, anxious to get out. And I would really appreciate it if we could find a plan to get the leagues open and get the kids playing basketball, soccer, and baseball games, because it makes a big difference to their life and makes a big difference to the parents and the families, and gives them a reason and gives them a purpose. And I really appreciate anything you do to get these kids back playing.
Thank you very much for your call. And next caller, please.
Clear.
All right. Thank you very much, everyone, for your public comment. We appreciate your patience and your input. And with that, I think we probably will go back now to Dr. Sisson to answer any questions that were brought up as we wrap up this item. Dr. Sisson?
Yeah, thank you. Several items that I wanted to address. Going back to the first caller who was asking on the data dashboard, when numbers decrease in terms of confirmed cases from day to day, what is the source of that? Typically, that's a transfer of a case from one jurisdiction to another. So cases are assigned to counties based on the county of residence of the case. But in some cases, people use a PO box. And when the case investigation, when the telephone interview is done, we learn that it's a PO box and that their physical address is in another county. And so then that case is transferred. So that was the case over the weekend when we went from, I believe, 185 to 184. That was a result of an interjurisdictional transfer. So it's not related to the sensitivity or the specificity of the testing or false negatives or false positives. These are confirmed cases. The only thing that changes is which county the case is assigned to, but it remains a positive laboratory confirmed case. The same caller also asked about suspected cases. Placer County does not report suspected cases in hospitals on our website, but it is a number that's reported by the state, and I know some people are tracking that, and there were some potentially concerning increases in those numbers that were brought to my attention this week. We followed up with the raw data, and we're able to discover that it really is an artifact of how the state is taking data reported by hospitals, in this case specifically Kaiser Permanente in Roseville, and so that is being correct. Kaiser's working to get that corrected with the state, but it appears that all of the persons in the facility who were getting tested, for example, pre-operative testing that the hospital is doing, those were being reported as persons under investigation or suspected cases improperly. And so the numbers were then, I believe, corrected. So Kaiser went from, I believe, 45 suspected cases to 19, which was the actual number. Most of those cases do rule out. So a person under investigation means that the test result is pending. If the test comes back positive, then they're reported as a confirmed case. So as I said, the county is not tracking suspected cases. Most test results come back much more quickly now, especially in the hospital setting, where in some cases they're able to get test results in 15 minutes. But in other cases, even their slower testing is getting results in 8 to 12 hours. So we don't have the 3-day waits in the hospital that we did several months ago, for example, when suspected cases was a much more relevant measure. So I would encourage residents who are following these numbers to really focus on confirmed cases in hospitals.
And thank you for that update. Appreciate that very much and that clarification, Dr. Sisson. I know you've got a couple more, but I appreciate that because the constituent who brought that to our attention was helpful to understand.
Yeah, absolutely. And then I believe that same caller asked about whether the county was monitoring for the multi-system inflammatory syndrome in children. And yes, health providers in the county have been asked to report any suspected cases of the MIS-C to the local health department, and then the local health department in turn reports those cases to the California Department of Public Health or the state health department. So we are indeed monitoring for those cases passively. Let's see, I believe the next question was around, or concern that I wanted to readdress was a misunderstanding about the website in terms of the language availability. So what I was speaking to, the website that just became available in Spanish is the OptumServe website for signing up for the free testing. Placer County's website is available with a Spanish translation, has been all along. The OptumServe testing, again, this is a partnership with the state of California, for which I'm extremely grateful, but it means that Placer County does not have control over the OptumServe website. They are a contractor of the state of California, and so we have been patiently waiting for that website to become available in Spanish. So just wanted to clear that up. The next point that I wanted to make or respond to a question was around my advocacy to the state regarding risk. And the caller spoke to risk in stage 2 versus stage 3, and certainly the original roadmap for the state was outlined as lower risk activities and businesses being allowed to resume in stage 2, and higher risk activities in stages 3 or even 4. It's gotten a little more complicated with the recent movement of some stage 3, which would be considered higher risk activities, into stage 2. But really what I was referencing in my comment is trying to ensure that there's consistency in the guidance across sectors and across activities. So a couple examples of that, haircuts and barbershops. Many would say that the risks of getting your hair cut would be similar to getting your nails done or similar to getting a massage, and that they could be equally mitigated with face coverings and good hand hygiene. And so, encouraging that if haircuts are allowed, then nails as well as massages should also be allowed. So that's the sort of risk-based decision-making that I would like to see. And another example of that is in terms of gatherings. If the state is allowing 100 people to gather in a place of worship or for a protest, it seems that they've deemed those activities to be of low enough risk that that's appropriate. And so I just want to see that same logic applied to other types of gatherings. For example, if 100 people can gather in a church, then why can't 10 people gather in a backyard? And right now the state has said no other gatherings are allowed outside of churches and protests. So those are the types of activities that I'm thinking of as I'm doing that advocacy to the state, encouraging consistent application of risk-based logic for their decisions. And then two last items. A caller asked about testing of people who were participating in the photo of the Lincoln High School class of 2020. That is not an activity that public health is currently participating in, not one that we would encourage at this time in terms of the testing. If a student who participated in that photograph were to develop symptoms and tested positive, then we would do our case interview and contact tracing like any other resident in the county who tested positive. But we are reserving our routine testing or surveillance testing to our highest risk settings where for example, our skilled nursing facilities. So I don't advocate for, what the caller described as random testing in the community at this time. But again, one of the items on the agenda later in this meeting is for a seroprevalence study. And I think that would be an opportunity to see to learn more about spread of disease in the community, not active disease, but people who have recovered and have developed antibodies. So I think that would be more appropriate than random testing for the virus community-wide. And then the last point or question that I want to address was around deaths of despair. I have directed our public health team to do an analysis of suicide over the last several months to see if we've seen an increase compared to the same time last year. But that analysis of death certificate data will take a while, so we don't have that result yet. But it's certainly an area of concern. As I mentioned in my comments earlier, there are unintended consequences of stay-at-home orders, and we need to balance many risks as we make decisions about reopening, and so that there are other deaths potentially associated with COVID-19, and that's something that public health is absolutely looking into, and I'd be happy to report back to this board once that analysis has been completed.
Great.
I think that was all the questions.
I think so. Thank you very much. We appreciate the feedback to the questions our community has asked. All right, so with that, no other questions from board members, we are going to move on to item 2A, which is a resolution requesting acceleration to stage 3 for Placer County and release of CARES funding.
Okay, supervisors, we're here this morning as staff to bring forward a possible resolution for your consideration. Jane Christensen, our Assistant County Executive Officer, is going to read through the resolution as well as the request for the additional CARES dollars that have been initially identified and for allocation to individual jurisdictions, one being Placer County. So I'll turn it over to Jane and she can answer any questions you might have.
Good morning, Board Chair and members of the board, Todd, Karen. Pleased to be here this morning to share with you a requested action to consider a resolution that is twofold. One, to request the governor accelerate commencement to stage 3 of California's pandemic roadmap for Placer County, and two, to release the federal CARES funding, which we understand was made available to other jurisdictions in mid-April. As you know, beginning with the governor's order on March 19th, Placer County has been in full compliance with state orders to slow transmission of the virus. On May 12th, the county was pleased to be among the first California counties to receive the state-authorized local variance to move further into reopening its economy with the phased and responsible reopening of Stage 2 businesses, as per California's pandemic roadmap. This authorization was predicated on positive health metrics the county demonstrated in its attestation to the state submitted just 1 day before, on May 11th. At that time and now, the county appreciates the governor's acknowledgement that health outcomes vary across the state, allowing some counties to proceed with reopening their local economies at disparate rates. As the county looks forward to the coming summer months, traditionally a critically important economic time, particularly for its eastern Placer communities, Placer County respectfully requests gubernatorial consideration to allow counties to advance at different rates in moving through the various stages of reopening their economies, specifically Stage 3. This is imperative not only for those Stage 3 businesses' health, but for the economic health of Placer County as a whole. A note on business preparedness. As many of you are aware that since this COVID crisis began, the county has been working closely with cities, chambers of commerce, and business groups to advise and educate businesses on the need for strict adherence to state reopening guidelines, even producing our own Ready, Set, Prep materials available on our website at our website /reopen/plan ahead to provide the tools and resources for businesses to responsibly prepare for their eventual reopening. Beyond opening Stage 3 businesses, we also request the distribution of the Federal CARES Act monies. As you may know, H.R. 748, or the CARES Act, became public law on March 27th, and as noted earlier, we understand other state and local governments began receiving their money the third week in April, while we have yet to see any of this funding available here in our county. As we continue to dedicate time and resources in support of state directives, we certainly request that this CARES funding be distributed to Placer County for those costs that we are incurring here at the local level. These resources are needed now to maintain the county's public health and safety efforts, as well as our support for the responsible reopening of our economy, as local governments work to support their communities through COVID recovery and the resilience of our businesses and workplaces seeking to reopen safely, consistent with the state guidance to date. With that, I'm happy to answer any questions.
Thank you, Jane. Supervisor Gustafson.
Jane, I had a question, or maybe Todd can answer this. The amount of CARES funding that we're due to receive appears to be disproportionate per capita to other areas of the state. Am I correct in that?
Disproportionately low.
Low. Disproportionately low. Is that correct?
So there were two things that took place. One was a direct allocation for jurisdictions above 500,000. Those got direct payments directly from the feds to that local jurisdiction. In addition, there were a couple cities that actually got allocations to some of the larger ones, LA being a good example. Everything else, all the additional jurisdictions under 500,000 got the money pooled back to the state. The state got an allocation of funding to be allocated out to individual jurisdictions, counties, and even cities if they so chose. That was the state's preference was to give about approximately $1.3 billion to counties, and then the cities got an additional, I believe, it was $370 million. As such, what was interesting, he came up when he did the mid-year budget revision and kind of talked about the budget for 2020-21 fiscal year. He made that allocation, which was just over $40.7 million to Placer County. However, he actually gave allocations to the other jurisdictions that had also already received a direct allocation, LA County being one of them. Some of our larger jurisdictions that had direct allocations, they also received an amount of a distribution based on as a population pro forma. So that $1.3 million actually, if he would have just distributed it out to only jurisdictions that didn't receive their direct allocation, we would have received significantly more money than what we ended up doing. But obviously $40 million is still sizable amount of money. But and again, the state has the ability to make those distributions and formulas in the manner they seem fit. But it is interesting that direct allocated jurisdictions and counties also got money that was state pooled dollars as well on top of what they had received.
And then when were the direct allocations provided to those jurisdictions?
The week beginning April 20th.
Okay, so we're over a month behind in receiving funds. And the reason I ask that is, you know, on the news you hear what Sacramento's looking at and how they're supporting both nonprofits as well as business community for recovery. Their Board of Supervisors are already talking about those sorts of questions. So I've had questions to me, you know, especially for some of our businesses that remain closed and haven't been allowed to reopen. They're continuing to suffer impacts, and we see record-breaking profits in a lot of the big box stores, yet small businesses are being devastated. So people are asking me, what is the county going to do? And we haven't yet even received the money to start deciding. Is this fairly certain that that formula will remain in place? Is that correct?
That is our understanding. Some of you may recall that Supervisor Gore actually wrote a letter some time ago requesting to understand even the process for accessing these monies, but we have yet to hear back from the state.
Right. Okay.
We didn't receive what even the allocation spread was of those pooled dollars till May 12th. So, you know, unlike other jurisdictions that actually received their money back in April, we were really in I would say, at a disadvantage in the sense that we didn't even know whether we were going to receive those dollars or what that allocation spread was even going to look like. And as Jane attested to, we still don't know how we're going to receive them, and that's part of the reason why we're talking about that issue today. Is we'd like to have this money and put it in place as quickly as possible at the local level.
Right. And then did they reserve any money for a competitive pool for unique circumstances of any kind? Do you know?
I'm not aware of that at this time.
Okay, so they just determined to give those jurisdictions more money, other jurisdictions less, and there isn't a competitive pool for
yes.
based on need or exposure.
It was based on per capita amount is how the allocation was spread.
So they gave everybody per capita the same amount when out of the pooled amount, but those jurisdictions also received funding directly from the feds.
That's correct.
Now I understand. Thank you.
And we have asked our lobbyists in DC why money was provided directly to those jurisdictions over $500,000, whereas not to all jurisdictions. And their simple response was these funds are being administered by the Department of the Treasury, which does not have the same grant infrastructure as other federal departments, so they sought to limit the number of jurisdictions with whom they had to work so that they had a manageable workload, essentially.
Okay, and one final question, I promise. If we had received per capita, if just the rural counties had received the full amount in the in the CARES Act funding, the number would have been, I believe you told us the other day, double?
It'd be close to double, yep.
Close to double. So it's very significant dollars that could be worked into our communities, in our cities, in our region. Mm-hmm. Okay, thank you.
Thank you, Supervisor Giller.
So when we look at the amount received by perhaps some of our neighboring counties like Sacramento County, or as we head down to the Bay Area, do we know what that direct allocation broke out to on a per capita basis? How much did Sacramento County receive?
I do not know that, but we can certainly find out.
We have the number. I'm just not sure how the allocation spread worked.
I'd be very curious to know, when you combine the direct allocation along with the percentage of the CARES Act dollars that they're getting, what it breaks out to on a per capita basis for other jurisdictions. Obviously in Placer County, looking at about $100 per person that we're receiving, somewhere in that neighborhood. Mm-hmm. But if others are double dipping, I'd be very curious to understand the governor's logic as to why that takes place, why it is that some jurisdictions, unless he is, just tantamount acknowledging that there are certain areas that by nature of their population base and concentration are harder hit than the rest of us, well, if that's the case, then maybe different rules as to how to get out of this. If you're going to give them more money because you think they're more greatly impacted, then maybe we need separate rules as well for those of us who are not. If you don't deem us that hard impacted, then why are you treating us the same as the others when it comes to stage 3, which is the other part of my comment. Thank you for the resolution in regard to stage 3. The 2 modifications that I would like our board to consider is on paragraph 2 of our yes, in the actual resolution, we have 5 different actions that we are requesting. In item 2, we speak to the issue of allowing us to qualify for the stage 3 as it regards numerous things, including in-person religious services. I would like to modify that to read without the 100-person limit where appropriate, or just without the 100-person limit, because if it's not the 100-person limit, it's the 25% of capacity. And from what I've heard from our larger churches, they're fine with starting with the 25% of capacity. So maybe we just say without the 100-person limit. And then nowhere in here do we speak to the issue that I know a lot of our community is very passionate about, and that is outside recreation, youth sports, those kinds of things, allowing youth sports to move forward as well in this phase. The other thing that I would, I guess, like some discussion on amongst our board is where we are asking for this, what is the window in which we expect to receive some kind of feedback from the state? Obviously, when we requested the acceleration through phase 2, within 24 hours we heard back, which was phenomenal. So I'd like just to get my colleagues' thoughts on how quickly or how long we're prepared to wait for a response to this before we figure out what else we might need to do. Those are my comments. Thank you.
Thank you. Supervisor Gustafson?
I'm sorry, Madam Chair. Do you want our other comments now? Or I had asked questions, but I'm happy to provide
Let's do
one.
questions and get any questions that we have. We'll ask public comment and then we'll come back and our board can deliberate.
Okay.
Okay?
Thank you.
So no other questions? All right. So let's go ahead and open it up to public comment, please. And this is for, just as a reminder, this is for item 2A on the resolution that our board is considering.
Please transfer in the first caller. Good morning. Please state your name for the record.
Yes, Catherine Curtis, and according to the live stream, the current time in the chamber is 10:38 a.m. With the recent spike of COVID-19 cases and another death, I don't believe the county is ready to jump into stage 3 yet. But as soon as the governor and his industry-specific task force agree on guidelines that meet public safety requirements, they are released for the local county's health department to allow reopening based upon each individual county's situation. With Arden Fair only open for curbside pickup, the Galleria is the only indoor shopping mall open in the area and will draw more than just our county residents. It wasn't even open for a full day before there was a fight inside the mall. When reopening Eastern Placer, remember the 3 Nevada counties abutting Lake Tahoe have combined 1,518 cases and 58 deaths. Sacramento County has 1,302 cases and 56 deaths. Placer County currently has, as of yesterday, 185 cases and 9 deaths. We have been averaging 1 new case a day for the last month or so. Do we need all those other counties with higher infection rates flooding Placer County because we opened up first? It is because we've been staying home our numbers are low. We need guidelines and time for businesses to implement plans and secure necessary supplies for a safe reopening. I do see spikes coming both here and Southern California in the next couple of weeks. Placer County has approximately 400,000 residents. We haven't even tested 10,000 people here. And we're looking at spending $100,000 to $200,000 to pay a marketing consultant, to pick 10 or 1,000 people to test for antibodies. And we're not getting people going to the free ones that the county's providing. Lincoln declared an emergency, and the city manager asked each of the departments to track their costs for possible reimbursement for COVID-19 costs, thinking that there would be special funds. There are there. I suggest we quit trying to rush things just to make a dollar at the expense of the public health. I do think the county should follow through on requesting CARES emergency funds. Maybe include what the county is actually using the money for in case it fits into a category with special funding in addition to the CARES emergency funds.
Ma'am,
It would
please
be
wrap
worth
up your
at least
comments.
trying and probably more effective than suing the governor when he is trying to save lives. Thank you.
Thank you. Next caller, please.
Good morning. Please state your name for the record.
Hi, my name is Vicki Thomason. Can you hear me?
Yes, go ahead.
Thank you for taking my call. I'm one of the owners of Byers Gymnastics Centers. We have 2 gymnastics facilities in Placer County and 1 in Sacramento County. We typically serve over 1,400 children each week at our facilities before the pandemic. I would like to offer my encouragement to the Board of Supervisors to quickly adopt the resolution to request acceleration to Stage 3 for Placer County and release of CARES funding. In addition, I'd like to request that all gymnastics facilities in the county be placed in a separate category, different from gyms such as California Family Fitness and other adult workout facilities. With a new category for gymnastics facilities, I would like to request that we be allowed to open our business immediately in a safe and thoughtful manner. Gymnastics businesses are like no other for the following reasons. Number 1, gymnastics is, by its very nature, a socially distanced activity. If you're closer than 6 feet from someone doing a cartwheel, you'll likely get kicked. Number 2, gymnastics facilities have restructured their cleaning protocol. We have increased our cleaning and sanitizing schedules to ensure safety for all and to meet all guidelines. Number 3, we have also restructured our class schedules to allow for smaller class sizes, less people in the facility, and shorter class times. Number 4, our facilities are large, thousands of square feet, allowing for a lot of space per person to move around and still maintain the necessary social distancing. Number 5, unlike other gyms, gymnastics utilizes special equipment which most people cannot purchase to have in their homes. This is a sport that must be done in a facility with balance beams, uneven parallel bars, bulking tables, etc. Number 6, every child in a class has a set rotation schedule. No child is allowed anywhere in the facility without direct supervision. There is no wandering around the facility. Number 7, children remain with the same group the entire class. Competitive team groups especially are similar to family groups. They always stay with the same people every time they are in the facility. In closing, I'd like to mention all the gymnastics clubs in Placer County that are chomping at the bit to get their businesses opened back up. Byers Gymnastics Roseville, Byers Gymnastics Rockland, Auburn Gymnastics, Miyagi Gymnastics, Empire Gymnastics, Flip To It Gymnastics, Gold Country Gymnastics, Feather River Gymnastics, and Extreme Gymnastics. Thank you to the board for all your time and your hard work for the citizens of Placer County. Thank you for standing up for gymnastics businesses.
Thank you. Next caller, please.
Good morning. Please state your name for the record.
Hi, this is Julia Sweeney.
Go ahead.
Hi, I wanted to first say that I totally support requesting those CARES dollars be distributed to our county. So thank you for continuing to push that. I wanted to give some feedback on points 4 and 5 of this resolution. So in point 4, I want to just bring up the section D, where it says less onerous criteria for moving through stage 3 should be established and published now for small rural counties similar to the county of Placer. And I would just question whether we need our guidance to specifically be written for small rural counties when we have areas like the Roseville Galleria. And so I would request that this be adjusted to more accurately reflect the diversity in our county, because the guidance and expectations should be different for that major shopping center as opposed to our more rural parts of the county. And I think this is in line with your argument about the state of California needing to have a different approach for different counties. And I would just like to ask that the board do the same with our county. And then with point 5, with this, I just think that you should get rid of point 5. I think it's completely ridiculous to vote on saying that the undue suffering happening now because of the stay-at-home order and not because of the pandemic. It feels like it's purely a grandstanding political point that really hurts our ability to come together as our community and go after the real problem here, which is disease. And so I think that point 5 places blame unnecessarily on our public health officials. And, you know, I don't think we need it. I think it's unnecessary. So I would ask that you not include that. But please, you know, fight for those CARES dollars and continue to advocate for a safe reopening for our county. Thanks so much.
Thank you. Next caller, please.
Good morning. Please state your name for the record.
Hello? Is this me?
Yes.
Sorry, this is Scott Holbert calling. Anyway, first off, this sucks being on telephone and not being able to be there in person. I really hope that you'll start allowing people to show up. But anyway, I digress. I want to thank you all for taking the vision and lead on getting us out of this nightmare. It's frustrating to see so many people that are just flat out scared and living in fear based on some concept of science, completely overlooking math and statistics. I feel it's important, and once again, I commend you, the City of Auburn, the city manager, the mayor, all working together to really improve the lives of your citizens and further to enhance bringing in some much needed revenue. As you know, I serve on the Auburn Recreation District Board. We're looking at $500,000 of losses, closing things like pools, which make no sense to me. Chlorine and sunshine should be something that our kids should be partaking in this summer, especially as we have 100-degree days. Just out of hand. I thank you, but I also do want to highlight, please, we need to figure out a way to get some live music going. This community and neighboring communities are filled with thousands of performing artists out there, and there are numerous venues that are available to provide safe, secure venues for this. Obviously, you'll have to play the game and do it with limited capacity. But I hope that we'll be able to have at least gatherings of up to 50 people for private events, and hopefully more than that for public events, providing appropriate safety. That's it. Keep smiling. Thanks. Carry on.
Thank you for your comments. Next caller, please. Hey, and you can go to the Fig Tree in Roseville, pick up a coffee, and listen to live music, just so you know.
Good morning. Please state your name for the record.
Hi, this is Ray Mayer. I believe in 1A there was an earlier discussion about whether lodging and short-term rentals were part of stage 3, and I'm not sure if that's clear, and I'm not sure if your resolution specifically requests a reopening of lodging and short-term rentals. I would like for that to be put on the resolution. Thanks.
Thank you for your comment. Next caller, please.
Good morning. Please state your name for the record.
Hi, good morning. Jeffrey Henson, North Lake Tahoe Resort Association. Thank you to Chairman Gore, and sincere thanks to the Placer County Board of Supervisors for holding this meeting and placing item 2A on the agenda for considering a resolution requesting acceleration to stage 3 for Placer County. I also would like to extend our appreciation for the outstanding work County CEO Todd Leopold has done, as well as Jane Christensen has done for our community. As we enter the peak earnings season for our North Lake Tahoe businesses, especially those along the lake basin and our lodging community, these businesses face the most dire of circumstances. Unless we can get in stage 3 in the coming weeks ahead, we can salvage some of our summer earnings season. Our lodging community and entire tourism sector will suffer catastrophic consequences. Our tourism-based economy has been in a total free fall since mid-March. Most businesses in North Lake Tahoe are owned, managed, and run by local residents. They've seen their revenue pools completely dry up and now face the worst possible nightmare. And that is to lose this summer's season if we can't get into stage 3 soon. Losing this summer would set in motion a series of actions that would be of the worst end of any projections of losses and outcomes for our business community. Many of our businesses will fail if this moves into June and beyond. With permanent job loss now becoming a stark reality and it decimate our local communities, our businesses and the jobs of thousands of employees that are both friends and neighbors remain in peril. I receive calls and emails daily from owners of lodging properties and individual short-term rentals that are desperate to reopen soon. They face zero cash flow, zero bookings for what is normally a peak season, and now hope to find solutions with their banks to keep from closing permanently. If we do not reopen full tourism by June, and this includes all lodging and short-term rentals, the grim reality of permanent closures and permanent job losses will be in play. We've been in constant communication with our lodging sector on meeting all safety and health visitor and staff protocols that would meet and exceed those lodging industry sector standards. They are ready to go. Chairwoman Gore and Placer County Board of Supervisors, I and we support your actions today to draft a resolution requesting acceleration to stage 3 for Placer County and to help us fully reopen all of our tourism business sectors in order to get staff back to work and business owners back in business. Thank you.
Thank you for your comments. Next caller, please.
Good morning. Please state your name for the record.
My name is Robert Vaughn, and I would fully support what the last caller said, not only for the North Tahoe area, but the rest of the area. But what I want to talk about here is the death that we have that we do not necessarily see. Let me run through some numbers with you and think about this. If the average person lives to be 81 and a half years old in Placer County, and there are 400,000 people in Placer County, each day that those 400,000 people lose is equivalent to 13 and a half lifetimes. So what is life? But it's time to enjoy church, it's time to vacation, it's time to be with friends, it's time for weddings. So if people cannot live their life, there are lifetimes lost. And if lifetimes are lost, that's just the same as death. So we have 13 and a half deaths per day that we're losing with 400,000 people. If they lose just one day, and then we have 9 deaths that are actual deaths. And I think you really need to consider that and weigh that in your decision making. Thank you.
Good morning. Please state your name for the record.
My name is Perry Lustgarten, and I'm a resident and voter in District 4. I am not going to be as articulate as many of the other callers that have called in earlier, but we're facing one of the worst public health and economic crises of our lifetime. So we need our elected officials and government leaders to stop playing games and instead focus on some good governance. There are people that are hurting, certainly small businesses, and we're not saying that these people are not significantly in a hardship. But the other issue that I haven't heard one word addressed to very specifically lines and plans that Placer County intends to implement in order for small businesses to act in a safe and measured way with their customers and with their employees. We understand that there's not a need here our numbers are not so staggering, but we don't know what the ramifications are going to be of the opening of the gallery this weekend. We've got 2 weeks for that to even begin to materialize. We have people coming in from other highly infected counties and regions of the state into our community, which is going to impact our numbers. And still, we don't know how we're going to enforce any kind of guidelines that small businesses and even medium-sized businesses will have to instigate in order to get through this time period. I'm not going to suggest that this is easy. I'm not going to suggest that it is complicated. But this thing has been politicized, and it's been instigated with the threats of lawsuits, with the threats of closed-door sessions, casting doubts on scientific and medical data, pressure brought by interested business leaders and a disgruntled former supervisor, and we have not as yet even dealt with what is really at the heart of this issue right now. Dr. Sessions is completely doing a wonderful job, and I think that it's absolutely premature for us to rush into stage 3 given the very serious ramifications of what's going to happen, potentially, how much our numbers are going to spike. And we cannot afford to be easy-peasy about this at all. Therefore, I'm really urging you to really consider very seriously not going into any already divisive nature of lawsuits, threatening the governor with that, or but for people who have political motives for doing just that. Placer County residents do not want the governor to.
Could you wrap up your comments, please?
That on multiple occasions. So please do not proceed with this ill-advised, costly, and sure loser of a suit, which is politically motivated. The ramifications of this folly.
Thank you. Would you please wrap up your comments, please?
Thank you for your time, and thank you for considering slowing this process down a little bit and putting in some sensible enforcement and guidelines. Thank you.
Next caller.
Good morning. Please state your name for the record.
Kathy Patterson.
Go ahead.
Good morning. I just want to, first of all, thank all of you for your effort in getting our county open. The other night, my husband and I had a nice evening out at the Club Car in Auburn and had a lovely dinner sitting in the restaurant. You know, everything was so safe and they were very careful. So I just appreciate all that you've done. And what I'm going to say is not toward any of you personally. This is just my own opportunity to vent, I guess. So I appreciate the opportunity. We started off being really patient and, you know, for the better good of everyone to stay at home and take care and make sure we don't spread COVID and to slow the curve. Well, and we didn't also want to overload our hospitals. Well, that really never happened. And now my patients, along with a lot of people that I know, have turned to frustration that we're just in kind of a holding pattern here. And then that's turned into some anger, and I hate to say that, but I'm angry that that we can take part of stage 3 and now move it into stage 2, because we're not ready to move into stage 3. And that makes absolutely no sense to me, that we can start moving the boundaries and the goalposts. And I'm just, I go to the park and I'm just disappointed that the playground equipment is cautioned off with yellow tape like a crime scene. And there's little kids standing outside the yellow tape going, gosh, I want to play, I want to play. And they're not allowed to even play in a playground. So I appreciate all of your effort to open up our county as quickly and as safely as possible. I think that people who were very, very patient are now paying a big, big price for being cooperative. And the people who were cooperative, I'm afraid, are not going to be cooperative for a whole lot longer because their patience is running out. So again, I just, don't take this personally. I just really appreciate all of you and your effort to get us open as quickly as possible into stage 3 and as safely as possible. Thank you so, so much.
Thank you. Next caller, please.
Good morning. Please state your name for the record.
Yes, my name is Justin Prettyman.
Go ahead.
Yes. Hi. Thank you guys all for all you're doing right now. I know it's not easy. These are unprecedented times and very challenging. I have to be honest that I couldn't disagree with the comments, not from the last lady, but the prior lady who called before, warning of a spike and having to be cautious before we go into phase 3. I sat in on the town hall, last week, on Thursday of last week. I couldn't have been more happy with the reports that came out of that. If I'm correct, and please correct me if I'm wrong, but I believe Placer County has had a total of 11 confirmed cases. Is that correct? And no new cases since April 20th, so over a month. And what the lady before me just commented, and what I asked while I was on the town hall, was one of the things that got brought up was what would slow down us advancing into stage 3, which is hotels and really tourism, which makes up about $1 billion of the economy up here. And what they said was a spike in numbers. Well, they also had the public health official on saying that Kings Beach is now testing and encouraging everybody to go to test, which will naturally increase our numbers. So I think you guys have done a great job so far. I just would not, you're going to see a spike. There's going to be a spike naturally with more people testing and as we open up tourism. I would just be prepared for that, but let's not throw caution out the window and say that we're going to shut everything down and go back to phase 2 if we see a spike, because that's naturally going to happen. We need to take the steps. We need to realize that that's a natural cause and effect, and that shouldn't slow down business. Like, people are hurting. Like, we are homeowners up here. We rent our place. We've been 3 months without any revenue. And Airbnb just outlined their protocol. I would follow the county's protocol for safely cleaning our place and making it safe for anybody who wants to come up here. But worrying about a spike when you only have 11 total cases in the county, I just think is off. You got to, we could triple our numbers and still be under 100 cases for the county. So we got to think realistically and practically about all this. And that's my comment.
Thank you for your call. Next comment or caller, please.
Good morning. Please state your name for the record.
Good morning. My name is Kathleen Crawford, and I'm speaking on item 2A. I believe that you should separate the two items on this single resolution. I believe that you'd have a great deal of community support for the release of CARES funding, and that would not create any controversy and would be exactly your job to be advocating for the county. So absolutely, I think that you have support for that. However, the first half of the resolution is not something that a majority of the county residents would support. And the reason that I believe that goes back to the flash vote, which said 58% of the respondents were concerned that the county would be opening up too quickly. Now, stage 3 is very quick, since we've only been in stage 2 for about 10 days and only 4 days for the opening of the Galleria. I also believe that on your resolution, items number 4 and 5 have some serious problems and should be rewritten. Item 5 could certainly be eliminated, and item 4 should be talking about the item 4 should just be rewritten to address the issues that were raised by the earlier speaker. I'm not going to try to use up my whole 3 minutes. I know you have a lot of people to talk to, but I want to point out to you that currently the online Zoom is at 10:51, so you are running more than an hour behind on the easiest way for people to access information about this board meeting. Thank you.
Thank you for your comments. Next caller, please.
Good morning. Please state your name for the record.
Hi, my name's Sarah S.
Go ahead.
I wanted to open by deeply thanking you for the opportunity to comment and for all of your efforts, echoing others who have spoken. The main point I want to make is really strongly urging the board to have clear data on cases and diagnoses before making the push to move to stage 3. And this comes from the perspective of 2 major events that have happened recently. Of course, the opening to stage 2, which we're still fairly fresh into, and also the holiday weekend. And I say this as a person who, my family and I are full-time residents of the Tahoe area. Just seeing around us, we know many of our neighbors who are majority second homeowners. We even like a lot of them. We get along pretty well with each other, but the reality is that more exposures have been happening, and to make a really thoughtful move to reopening, I think it's important to understand what we're talking about in terms of cases around here. And of course, because of the way that we are testing right now, if we were able to really test everyone, including people who are asymptomatic, we could have an immediate picture of what's happening, because that's not just the reality of where we're at right now. We have a little bit of a lag, as everyone knows, in seeing where our diagnoses are. So given those 2 pretty notable and unique events that have happened, I really strongly urge the board to have that full information before moving into this next phase. And I say this as someone who, we have friends up here who own businesses, are slowly reopening or looking to reopen, who work in the hospitals with the capacity that they have. Our neighbors are grocers and work at the post office, and with everyone in mind, I think we all just really lose if this decision to move to stage 3 happens without full information. If the numbers are there, let's go for it. But if the numbers just aren't there, if we move too fast, it's just really going to be a loss for all of us. So thank you again for all you're doing. Stay safe and healthy, and thanks for the opportunity to comment.
Thank you. Next caller, please.
Good morning. Please state your name for the record.
Samir Tuma.
Go ahead, Samir.
Good morning, Chair Gore, members of the Board of Supervisors. I want to focus comments, I've got a couple of different areas, but I want to focus on the topic of public health. And the topic of public health, listening to Dr. Sisson's comments earlier before, it's good to hear her talking about the totality of public health, not simply the COVID-19 impacts of public health. And looking at, as she called them, deaths of despair is important. But I'd also like to see the county begin to track in a meaningful way impacts on mental health, domestic violence, calls to mental health lines, and other related issues that are arising as an indirect impact of the COVID-19 crisis. And so I think if we had some way of getting some data, regular reporting, so that the public is aware of these impacts that by and large go undiscussed and unquantified. I think it would be very helpful so that we're looking at the totality of the public health issues. The other comment that Dr. Sisson made was looking at things on a, quote, risk-based logic, which I think is absolutely appropriate, but befuddles me, quite honestly, that we're talking about large gatherings in houses of worship, which I support, but at the same time saying that it's inappropriate for families or couples to travel to areas where most of their activities are out of doors. And so the risk-based analysis doesn't seem to be flowing through to tourism. Then I want to switch over to a little bit about the role that lodging could play as a major partner with the county and with public health. Looking at this last weekend, there was a lot of people in Tahoe, and those people are coming up with a wide range of knowledge or information regarding what's going on and what the requirements are, but that range isn't necessarily an informed range. And the opportunity that you have working with lodging is for lodging to be really a portal of communication to guests coming to the area, where we have the ability to communicate with them before they get there, when they get there, and while they're there. Lodging and the North Lake Tahoe Resort Association have worked together to procure mass quantities of PPE, so those are available to distribute to people that come as well. And so I think it's important to think about the opportunity that you have to work with lodging to really help improve the situation on the ground, because tourists are coming, and right now we're really not in a position to interface with them in a meaningful way that allows education and supply of PPE. Finally, there seems to be some confusion as to whether tourism is now in stage 3 or stage 4, which may impact the language in your resolution, but I think the intent is, among other things, bring lodging and tourism into basically being allowed to move forward at this point or within the next couple of weeks. And so I would just say that maybe the language needs to be adjusted to reflect it's not just a movement into stage 3, but a movement into where tourism would be allowed. Thank you very much for your time, and appreciate all the hard work that you all are doing.
Thank you. Next caller, please.
Good afternoon. Please state your name for the record.
Alexander Moralatos.
Go ahead.
Chairman Bohr, members of the board, CEO Leopold, and Dr. Sasson. I'm going to give you a business perspective that maybe reiterates some of the excellent points during this public feedback. I am the general manager of the Moralatos Lakeshore Resort. We're a 32-room motel located on the shores of Lake Tahoe and Tahoe Vista. First, I applaud all the work that's been done to date, and I support the resolution, given, especially reflecting the feedback that's been provided. Companies, small business owners, and mostly employees are looking for your leadership. The Moralatos Lakeshore Resort has completed the COVID-19 industry guidance for hotels and lodging checklist. That means we have updated our protocols for housekeeping, for our front desk, for our beach service, and even protocols for our guests that are designed to minimize contact with staff and to maximize the distance between our guests. We are also anticipating complying with the recommended guidance of 24-hour rest periods between reservations. And on Friday, I took all of my housekeeping staff and front desk staff to the event center in Kings Beach and had them tested. I wonder what would happen if all businesses started doing that, if we'd have an issue as it relates to the use of that facility. I also received a PPP loan and am due to have my payroll achieve where it was and consume 65% of that loan by July 2nd. So I'm in a position as a small business owner where I'm being incented to bring my employees back. I planned to bring them back. I'm only waiting for our leadership to give me the approval. I think I respect the fact that you need to respect people's rights. We all do. Those who need to stay home and feel they should.
those that need to go out need to be able to respect others and comply with guidelines. Business owners bear the responsibility, just like the public sector, to implement and ensure compliance of those guidelines. I sent to the clerk of the board this morning 2 images that I had forwarded to Cindy Gustafson, our supervisor, from May 15th, a Friday, where my 275-foot beach was empty of anyone or any recreational amenity. Next door to me is the Sandy Beach, a public beach, uncontrolled, full of people trying to self-govern with no knowledge, no understanding, and a bunch of locals and visitors. If I were to predict to Sasan where we will see a flash, it'll be next door to me. I'm only asking that the Board of Supervisors reflect the fact that 60% of our TOT is from STRs, short-term rentals, and that motels without those and motels with outdoor amenities such as ours be allowed to serve Placer County and our neighboring counties, including Washoe, as part of the county's reflection of meeting the health care and wellness needs of our citizens and allowing them to access lodging that provide a safe haven for them and their families.
Alex, please wrap up your comments.
Declared that it's open. I'm done. Washoe County is opening up on June 4th. And as far as Tahoe goes, as a message to the public, I urge you to also work to coordinate any messaging with the other counties so that we can serve our citizens and their health needs. Thank you.
Thank you. Next caller, please.
Good afternoon. Please state your name for the record.
Afternoon. My name is Barbara Smith. I am a resident of District 5. I'm concerned that as part of this resolution, this board would consider requesting an expedited move to Stage 3 reopenings throughout Placer County so soon after we received authorization to move judiciously through Stage 2. We all know businesses are hurting, and the unemployment numbers show the pain and fear this pandemic has wrought on our community. But we also cannot ignore the guidelines and procedures that have allowed our county to remain relatively healthy. Unfortunately, after watching numerous local and national news reports, it seems that enough members of the public, residents and visitors alike, are willing to disregard social distancing protocols and refuse to wear a mask, in some misguided impression that their civil rights are in danger. This misconception is exacerbated by public officials who, at every level, from the federal government to this body, cast doubt on science and data and work to manipulate public opinion for their own purposes. What's in danger is our public health. You are asking businesses to meet strict sanitation practices and distancing guidelines, but are you giving them the mechanisms by which they can enforce compliance by customers to protect their workers and other customers? Are members of this board continuing apparent attempts to undermine the expertise and authority of Dr. Sisson, leading potential customers to neglect the very practices that have kept them safe? What is the plan if the inevitable resurgence of infections becomes a runaway outbreak? The list of what we do not know about COVID-19 is long, but we do know that we possess an understanding of how to keep people safe and protect all segments of our population. Or perhaps we have just decided to sacrifice portions of our population for economic gain. Unfortunately, with these repeated special meetings, it appears that members of this board have been working to gather allies to justify potentially calamitous actions. In other words, some of you have decided that the human capital stock is ready to go back to work and consume no matter the ultimate cost. I think we have to look at what the future holds for us. Thank you.
Thank you. Next caller, please.
Good afternoon. Please state your name for the record.
Lisa Larkin.
Go ahead.
I agree with the previous caller about separating CARES from the acceleration to Stage 3. I think those are two completely separate issues, and I would support the release of CARES funding, but not the acceleration of Stage 3. This pandemic is not over. The website, just as I was waiting on this call, added 3 new cases today during this meeting. Just because we're starting to reopen phases doesn't mean the disease and the emergency has gone away. For the person that just said 9 deaths, those numbers are due to lockdown for our community. You haven't seen the numbers of deaths yet. It's just beginning. Following the state and government orders, shelter in place has given us a reprieve and flattened the curve. However, opening too quickly and not taking proper precautions will certainly cause the disease to surge in our community, spread quickly, and we will be unable to trace and track and keep up with that. You will set us back, and if cases surge, we will have to shut down again. Sweden took a relaxed approach to this, letting people go about their business, and now has 6 times the fatalities that Norway and Finland do, who both are taking stringent precautions. I understand that small businesses need to reopen, and the way to do that safely is to do it in phases, but not so fast that we don't have a chance to see the spread a few weeks down the road. The data clearly isn't available yet, so I disagree with pushing to move to stage 3. Our congressman in District 4 has stated that people will do the right thing to protect the people of this community. Clearly, if you've been out and about, that is untrue. It should be mandatory for all employers, employees to wear masks. I've been to several places where this is not being enforced. Green Acres is one. Some employees wearing masks, but the cashier was not. The popcorn store where I was buying a gift and supporting a local business was not wearing a mask, yet had a sign regarding its importance. There should be a way to report businesses not following this mandate and follow up by the county or enforcement to comply or be closed down again. Businesses that are requiring customers to wear masks are putting themselves at risk to angry customers not wanting to wear a mask. Quite frankly, if a business can require a shirt and shoes for health reasons, they can require the customer wear a mask. I believe it should be mandatory for all customers to wear masks at essential businesses to protect all customers: grocery, pharmacy, banks, utilities, medical facilities, etc. Businesses need help with enforcement on this by the county, and public mandating it could help. Businesses need a method to report troublesome customers or be able to bring in law enforcement to help in escalated situations. Having an 18-year-old employee or other employee at risk of confronting a customer is unacceptable. So masks should be mandatory. This protects our employees and the customers and would allow more businesses to open. Restaurants are a bit different since people can't eat with a mask on, but people should be required to wear a mask while waiting in line. I'm wrapping up. This is not a rights infringement. It is a public health issue. And so I would like to see more things lined up before you just start pushing this thing out to the community. Thank you so much.
Thank you. Next caller, please.
Good afternoon. Please state your name for the record.
Hi, it's Bill Halden from Rockland, and I wanted to speak in support of this request to move to stage 3. I think Placer County is ready. I can tell you our businesses are ready. They have spent the last 2.5 months planning for reopening with increased safety guidelines. They're not going to be starting on that tomorrow. They have been doing it for 2 months and getting ready. And I think to look at the data is important. And in the last 14 days, Placer has registered 4 cases per 100,000 residents. If you look at other counties that were allowed to go into stage 2, Orange County, 58 cases per 100,000 residents. San Diego County, 51 cases per 100,000 residents. Santa Barbara, 48 cases per 100,000 residents, and even Sacramento, 8 cases per 100,000 residents. We're at 4 cases per 100,000 residents. We stand out not only throughout the state, but in the region for having very few cases, and we've tested 10,000 people in Placer County, which proportionally is quite a few. Sacramento County, even though it's 4 times the size in terms of population, has tested only 15,000. So I think we are a standout in terms of the impact, and we should move to stage 3. We have businesses that are ready, but they are desperate to reopen. And for many of these businesses, opening up in 2 or 3 weeks, 4 weeks, 5 weeks is only going to add to the economic ruin. They're going to open, if they were allowed to open tomorrow, they would open the same way that they will in 4 or 5 weeks from now. They're ready, our residents are ready for them to reopen, and our residents are ready to be able to make the choice themselves, to go to a business or to stay home. Clearly, elderly people are more at risk. Every statistic shows that in this whole effort. I believe 80% of the deaths are people 65 and over. Those people need to take extra precautions. But to hold our businesses back when we have done such a great job at this point of all the things that have put us at this low rate of infection, it's time for us to be able to move forward. And I appreciate the board and Dr. Sisson keeping these issues at the forefront and always asking what makes sense. There are too many things, unfortunately, that come out from the state that don't make a lot of sense. And after time and after a lot of damage, the state even backs away from them. So again, thank you for your time and appreciate you taking the time to hear me out.
Thank you for your comments, Bill. Next caller, please.
Good afternoon. Please state your name for the record.
Kenneth Rhodes.
Go ahead.
Yeah, hi. I'm a small business owner in Loomis, California. I own Body and Soul Tattoo and Piercing. We're a small tattoo and piercing shop, family owned and operated. Myself and my daughters are the artists there. We've been a part of the community for close to 10 years now. We are all OSHA certified in bloodborne pathogens and sterilization procedures and inspected regularly by the health department, Placer County Health Department. We follow strict sterilization procedures and guidelines and have done extra training on through the WHO on infection prevention and control, IPC, for COVID-19 for sterilization procedures. I know that, you know, we closed down before anybody even asked us to, because we care about our community, our clients, and our family. We've been out of work now for 2.5 months. Me and my family are in dire needs right now. We never got any kind of SBA help. We really need to get back to business. And there's no reason why, you know, we came up with the new sterilization procedures and stuff for our clients. We've got all the PPE for our clients and for our artists, including face shields. And I see this like the big mall opening and stuff, and people aren't social distancing. Everybody's together. We are willing to shut down to public walk-in business and stuff, and stagger appointments so people don't run into one another. We've also brought, you know, stuff to take people's temperatures with and follow strict guidelines of only one person in the shop with one artist and nobody hanging out, staggered appointments. And we're just really looking forward to getting back to work. I mean, we've been out for almost 2.5 months now, and really in fear of having to shut down our family business that we've worked with 15 years to develop here. And, you know, we're not just takers in the community, you know, we donate back to charity and local charities and everything else. And it's just not right for malls to be opening and all that kind of stuff when we are a more sterile environment. We follow hospital sterilization procedures in between each client. And there's no reason for us not to be able to open. I'm not a very good public speaker. I'm sure I speak for a lot of other small businesses in the area, especially the hair salons and barbers. I can follow the same kind of sterilization procedures with proper PPE on and conduct proper business as well.
Can you wrap up your comments, sir? We appreciate them, but if you can wrap up.
Yeah, thank you.
All right, thank you very much. Appreciate your call. Next caller, please.
Good afternoon. Please state your name for the record.
Hi, Dr. Katie Carlson.
Go ahead.
Thank you again for the opportunity to comment once again. I'm listening carefully to your meeting, and I'm really honored to be able to give you more commentary. On this resolution, as a pediatrician, again, I am strongly concerned about the impact of tourism and opening of our county too quickly. I do agree that we need to open, and I do understand that it is critical for our economic recovery. But there is an element of Placer County, because we are so blessed to have Lake Tahoe as part of our county, there will be a larger impact, I believe, as people transport themselves to Tahoe during the summer months. Of even asymptomatic transmission can occur. What we know about this virus, and what you probably have heard in the past, is that it is estimated as high as one infected case can infect 5.7. The R0 is 5.7. To compare that, influenza's ability to infect others is noted to be 1.3. And we know how contagious the flu is. So as a doctor and as a Placer County resident, I strongly urge you to not rush this process and to really go slowly with reopening. This is important. I know it's important. I know you guys are doing it for all the right reasons, but I just strongly urge you to take care and not move too fast. Thank you.
Thank you for your comment. Next caller, please.
Good afternoon. Please state your name for the record.
Andy Harris. I really appreciate all the work that the county's done. I've been a proud resident here for 43 years. I live in Granite Bay. But I don't think we can live in a sterile environment forever. Statistics show the death rate is relatively low on this. Everybody doesn't die who gets it, despite what the media would have us believe. If over 1 million people have had it and around 100,000 have died, that means 900,000 have had it and they're doing fine. So I think it's time to go to stage 3. We have the freedom to go out if we don't want to or stay home. I'm 83 years old and I don't have any problem going out and not wearing a mask, and I wash my hands and I do everything they say. And I think we're set up now. If we have an emergency, we can handle it. We know what to look for. So I really encourage you to move ahead. It's time. And thank you for all your hard work.
Thank you for your comment. Next caller, please.
Ron Cohen, go ahead and unmute your mic and give your comments.
Hi, yeah, sorry, I was just muting the governor's comments there. Ron Cohen from Squaw Alpine, thanks for the opportunity to comment. So I'll just make some bullet point comments. As far as the resolution in its present form, I would avoid arguments about constitutionality and about the stay-at-home order being the cause of our troubles. When the governor has received those kinds of comments, he's just ignored them and he's prevailed in court on them. And so I think they weaken the arguments. I think that, as far as our issues up here in North Lake Tahoe, the governor has repeatedly stated that 70% of the economy in California is open. But North Lake Tahoe is almost 100% tourism based. So I think it's important that we state that over and over again and get the recognition that 70% of our economy is not open. And our local governments and the critical services they provide are almost entirely funded by by TOT and by property and business taxes that all relate back to tourism. And so we're building a fiscal disaster in North Lake Tahoe and the Eastern Sierra that needs to be addressed. And I don't see it being addressed by the state at this time. Instead, as Dr. Sisson said, we're focusing on definitions of businesses, and we're not addressing this coming fiscal disaster in our region. So right now, with the amount of tourism that's occurring, we're seeing public health concerns that are created by tourism. Trash and waste in the forest fires being started, environmental damages, all those things are occurring, and nothing, governments don't have the resources to deal with them. So if the state's approach is to say it's closed, they need to send resources to help address the issues that are occurring here, because it's not closed. We know people are coming. We know that in Nevada, hotels are open, so you can stay in Incline Village, but not in Kings Beach. And that kind of difference is going to lead to a complete breakdown in order, to a situation where only those who violate will win, and those who follow the rules will continue to suffer. And so, that's all a statement of the problems. Honestly, as much as I want to get back into business, I'm also very aware of the public health issues. And so when I look at an approach like this, for us, lodging is critically important to get going. For so many of us in North Lake Tahoe, lodging is important. We want to open lodging. But an approach like this to me is dead on arrival in the state, unless and until the action from the board can be accompanied with a supporting action from the public health officer. And so does the public health officer support the resolution on the table today? If she doesn't, let's get to work on something that she can support. The guidelines for lodging are posted. They have been by the state for quite some time. The lodging businesses up here are ready to address those. Let's work together to get a self-attestation that both the government and the public health officer and the business community are all willing to move forward together. Without that, I think we're just sending letters that land on a desk somewhere. So I know my company and the companies I work with in the area are more than willing to abide by the rules and move forward in a responsible manner.
Thank you, Ron. If you could wrap up your comments.
Yeah, appreciate the opportunity to address you and to work on that in a productive manner. Thank you.
Thank you. Next caller, or Zoom caller, please.
Sonia, can you give your comment? Sonia, go ahead and unmute your mic and give your comments.
Good afternoon. I've been a resident of District 3 for 22 years, and I'd like to say that I completely agree with the resolution, along with Supervisor Euler's modifications. And I urge all of the supervisors to vote to approve the resolution with the modification. And I'd just like to say, this isn't directed at the Board of Supervisors, but the overall guidelines that are coming down the pike, that it's important for them to be fair, logical, and even-handed if they want compliance. And evidently compliance is an important factor in all of this, but the rules need to be fair and logical for everyone. Thank you.
Thank you for your comments. Next caller.
Ron Parson, go ahead and unmute your mic and give your comments. Ron, we're not hearing you on our end.
And we move to Zoom callers now. And we can't hear you, Ron Parson. So if we've got another caller, we can come back to you.
Jim, go ahead and unmute your mic and give your comments.
Jim on Zoom, if you want to unmute, there you go, please.
Thank you. I wasn't sure if that was me you were speaking to. Thank you for this opportunity to speak with you. My name is Jim Phelan. I'm from North Lake Tahoe. And I just want to make a comment that it seems like when we're asking our destination businesses to be the risk managers for COVID-19 seems a little backwards to me. I think that the risk is, we're one of the healthiest counties in California, and I think the angst is that we don't want to get sick from our visitors. And so we should be, I just want to make a comment that I think we should be managing this from the start, not from the destination. And that's the only comment I wanted to make. Thank you.
Great, thank you. Next Zoom caller, please.
Ray Meyer, unmute your mic. Give your comments.
We're not hearing you. All right, Ray Meyer, no? Going one, going twice, all right. Anybody else on Zoom? Because Ray, you are blocked or you're muted. All right, doesn't look like we can hear from anybody else on Zoom, so thank you very much for those comments. Do we have other comments? How many do we have? All right, we moved from, we've got a call, we'll take that. And just a reminder, folks, we appreciate your input, but if you've already heard your comment made, please note we've heard it. Go ahead, please.
Hi, this is Ron Parsons. I'm in Lake Tahoe.
Thank you, Ron, for calling in. Go ahead, please.
Look, you guys are all doing a great job. You're exercising good governance.
Turn it up.
Supporting what you do, so thank you. Very quick comment. You've heard it from everybody up here who's in a business leadership position. We as businesses are the ones that can help you get this right, but we can't do it when we're under orders to stay closed. It's confusing, especially with the volume of traffic we are seeing up here and people walking onto our properties and demanding services. We need to get to the point where all the businesses are open. We can all open up with the restrictions, and as multiple people have said, we have the rules. We know how to do this. I encourage you to adopt this resolution with Kirk's changes and move forward. We as the business community are ready. We want to help, but we can't do it without the authority to do that. So approve this. Ask the governor to let you all be in charge. Let's work at getting our community operating functionally and safe. The environment we're in now is untenable with a huge volume of people coming up here and us having to skirt the edges of the rules just to try and keep our staff safe with this volume. So I encourage you to adopt this, and thank you for all the great work you do.
Thank you for your comment, and I think we have one last caller, and then we will close public comment.
Good afternoon. This is Cheryl Berkema again from Placer County. I have a concern about the special meetings, the number of special meetings as this one, and the lack of noticing in the newspapers. So as many callers as you have, there are many people that do not know about these meetings. And so I would challenge the proper noticing of individuals. It also speaks to the volatility of the management team in general. When you have special meeting after special meeting, as someone mentioned before, it seems as though there's agendas being pushed, and the votes are always in sync, which is very rare for that many decisions to be made by that many people and never have anyone abstaining or having a different viewpoint. The resolutions, the number of resolutions that are being put forward are an attempt, in my opinion, to provide the framework to sue the state. These resolutions, a previous caller actually mentioned, you're overloading the resolution with multiple items. They should be separated. Getting money from the state is different from opening to a different stage. It confuses the issue. Another caller mentioned that putting constitutional language in is likely to have the comment ignored. Supervisor Euler has actually had on social media bantering back and forth about constitutional issues. I agree with that previous caller that it sounds like grandstanding, and that's probably how it will be received. Jennifer Montgomery, a previous supervisor, also mentioned you're likely to lose in those lawsuits. There is firm ground, and I don't see, with 58 counties, I did a search, I don't see a single other county suing the state. I see gyms, churches, different groups that want their businesses to be able to open up sooner, but it kind of says something about Placer County, the number of lawsuits that we have, and the way that these things are put forward. It says that there are other agendas going on with the lawsuits. I encourage you to not put this resolution forward other than the CARES part of it, and to look at the 70% statistic in California that wants and supports the governor to open up slowly, as did your own Placer County survey. I urge you to listen to the people of your county, the overwhelming majority that said they do not want to open up too fast. Thank you.
Thank you for the call, and we are closing public comment. And just to the point of special meetings, I think people need to understand that in a challenging crisis that we have been in, there are a number of issues that our board must consider so that we can do what's best for our community. Every meeting has been noticed appropriately. We have done this according to the Brown Act and what is legal, and we are working really hard to address issues of major concern to our community. So I want to make that very clear. All right, with that, we are going to have some deliberation about the resolution that is before us. Supervisor Gustafson.
Thanks. I have a number of comments, but I wanted to propose a couple changes in the resolution for our consideration and deliberation. One is to agree with Supervisor Euler's earlier changes. And then on item 2, I would insert designate the County of Placer to qualify for Stage 3 of the pandemic roadmap to allow the safe and limited reopening.
I'm sorry, Cindy.
So add the word safe.
Under 2 or 3? Under 2?
I'm under 2.
First, under.
It says designate the County of Placer to qualify for Stage 3 of the pandemic roadmap to allow the, and I would insert safe and limited reopening of personal care establishments, etc. I don't think any of us disagree, and what we hear is people do want a safe reopening. I agree with the earlier 25% on the current religious gatherings and taking out the 100-person limit, because I too find that not equitable for large locations. So that was already made. And Supervisor Euler had also talked about youth sports programs. The other item that I'd like to insert, and I think it would be a separate number, would be that we ask the governor of the state for specific funding for businesses who have been forced to remain closed beyond the Stage 2 reopening. So the longer this continues on without the governor allowing those businesses, that he designates some of his own funding. I know we can use our CARES Act funding, but we're not the ones requiring them to stay closed. So I'd like to at least ask for their consideration of assistance to those personal cares facilities, gyms, lodging for tourism, those sorts of things, that be considered. And then I would agree with a couple of the callers and in eliminating the entire fifth paragraph. I don't know that that helps us, and I don't need to send a message that I think is covered in item 4. In other words, most of the issues in 5 are also considered in 4, and unless County Council has something different to suggest, I think that's a reiteration. I also agree with maybe making a point that 70% of our economy isn't reopened in Placer County at this time. Because I do think the larger jurisdictions not only have gotten the money, but are also moving forward. And I have some other comments, but those are just for discussion. And then Supervisor Euler asked about a date. Earlier, 2 weeks ago, or I'm sorry, May 11th, the Resort Association, North Lake Tahoe Resort Association, sent a letter to the governor asking for a reopening of tourism on June 1st. And I'd like to continue to echo that date as a reopening. That gives us 5-6 days to get those guidelines out to businesses and to have them reopen beyond what's already been given by the state. So that would be the timeline I would look for as a potential suggestion. So.
Thank you. I appreciate those suggestions. I think I'll just on.
If I may, just a quick question clarification on item number 5. I think that item number 5 makes a point that is important for our board to make. However, I think if we were to simply strike the words "from restrictions on their constitutional rights," if you strike that and simply have it read, jurisdictions are unduly suffering, comma, not because of the COVID-19 emergency, comma, but because of the present stay-at-home order, and simply eliminate the reference to the constitutional rights, because the rest of it is, I think the point that our board has repeatedly tried to make is that this stay-at-home order thing is killing us. So if I'm comfortable making that modification, if that satisfies your concern.
I would like to keep that, but clarify how you wanted that, because I was thinking we could actually take out, you're saying strike restrictions on their constitutional rights, correct?
Yeah, it would be are unduly suffering, comma, strike from restrictions on their constitutional rights, so that it reads, consider Placer and other similar small rural jurisdictions are unduly suffering, not because of the COVID-19 emergency, but because of the present state of emergency and guidance. And that, so that just by eliminating just those 6 words, I think it gets at the concern that Ron Cohen raised and that I think Supervisor Gustafson is reflecting.
Okay, I don't have a problem with that, and I didn't know if we needed to strike from "and" through the stay-at-home order, but I mean, I think this is important that we get our point across that
Absolutely.
We are suffering. So, I mean, if I'm fine with striking that. I didn't know if we needed to strike through the "and" guidance from the CDPH for modifying the stay-at-home order, or do we want to keep the stay-at-home order in there? Yes, we do. It is that's the issue. So yes, let's keep it. Okay. All right, and I appreciate the June 1st date that we want to hear back, because our folks up in Lake Tahoe need to hear back, and they've requested that input previously. All right, let's see. Supervisor Holmes and then Supervisor Wygant. Let's just talk about the language of the resolution. If we want to make changes, let's start there.
Thank you. I just need clarification about what all the amendments are that have been, and you mentioned 25% of church participation. Is that 25% of the capacity of a church?
I think
yes.
That's what the governor's order, I'm sorry. I do believe that's what the governor's guidance was 25% of the capacity, not of the total membership, because you're right, on any given, yes, yeah.
Correct. All right. I don't have any other questions, but before we vote, I would like to have a clarification of all the amendments. And I know Supervisor Wygant has some comments, so there may be more amendments as far as I know.
Robert.
No more amendments. I support Kirk's modifications to 2. I support what I think is consensus that came out of the conversation between Kirk and Cindy regarding item 5 being either deleted or not, but I specifically think it would be wise to keep 5, but delete the firm restrictions on the constitutional rights component, because there are some nuanced differences that are compelling, I guess, so that maybe that's not, that maybe they aren't nuanced differences. But it's interesting to have conversations with constituents and point out that there's still a stay-at-home order in place, while at the same time we can go to a restaurant, but under what I consider to be confusing and irrational guidelines that are not even guidelines, they're actually orders. So I think it just helps build our case. And I've read recently, Dr. Sisson may actually have some data on this, but there's a huge difference in the spread in Southern California urban area as compared to the Bay Area urban area. And we have no idea why that is. I don't think people have any idea why. There are theories, and we need more research. But certainly, urban versus rural is even more dramatically different. And we're trying to craft something that is both safe, but yet minimizing the damaging of our economy, knowing that there will be adaptive management probably. And as we learn, we'll be able to better go forth more intelligently. And then the addition of number 6 with the dollar component, that's also, to me, obvious and a no-brainer that should be pointed out.
Okay, so it looks like we have agreement on 5 with the changes there. Go ahead.
You know what I'd suggest? Why don't we go through them individually to make sure for the record that we're all clear what the board has in front of it. So number 1, I heard no proposed changes.
That is correct.
Number 2, let me just read what I think is the final version. Designate the County of Placer to qualify for Stage 3 of the pandemic roadmap to allow the limited reopening of personal care establishments.
Safe and limited reopening.
Yes, she had to insert the word safe. The safe, allow the safe and limited.
Thank you, see? I had the in the wrong place. To allow that the safe and limited limited reopening of personal care establishments, entertainment venues, lodging, in-person religious services without the 25% capacity.
No, without the 100-person limit.
Without
the 100-person limit.
Without the 100-person limit, and youth sports. Now, I have / programs because I heard
Yes,
both.
please, thank you.
Youth sports
Or-
programs.
Yes. Or in the alternative, provide for these businesses inclusion in stage 2.
Yes. I think we have agreement there. Yes.
Yep.
All right, now, I heard some discussion about June 1 in the tourism industry. So let me suggest something for item 3 and see if that comports with where the board was going on this. I won't read the whole thing, but in 3, go to the 3rd line, which says, at the hotel and short-term rental industry and tourism industry, to reopen contingent on meeting specified public health criteria, or in the alternative, allow the County of Placer to enter into stage 3 with its own developed criteria for such businesses, with the goal of safely opening the same by June 1. This is simply a suggestion based on the conversation I heard.
How about no later than June 1?
With the goal of no later than?
Yes.
Okay. Should I go on?
Yes, go ahead.
Okay. I didn't hear any changes from the board for number 4, although we did have one commenter who mentioned something about using the term small rural counties similar to County of Placer. But it's really up to the board whether you wanted to change that.
I'd like to keep it. Anybody else? Okay.
We're okay with that? Okay. And number 5 then, I'm just going to read the very beginning where the change was. Consider that the citizens of the County of Placer or similar small rural jurisdictions are unduly suffering, not because of the COVID-19 emergency, and the remainder of this section remains the same.
Yes.
Okay.
All right.
Has that captured everything?
Yes.
No.
No.
What?
There was one other suggestion I had made to add a numbered item for funding, special state funding, or designate state funding to assist businesses that have been precluded from reopening in stage 2 as of May 12th.
You know, I hear that, and I just, I don't think it's even worth asking. I think we need to ask for the money that we know we can get, and then see how we can use those dollars to help our businesses.
Okay.
And let's advocate to get them open, because we won't get any traction there. We did get the numbers, though. It was helpful to find out what Sacramento County is getting. So Jane Point sent to me the difference. So Sacramento, I think it's Sacramento County, is $132.99, $132.99 per capita versus our $101.99, which is a difference between $40 million and $53 million. That's the difference.
May I expound upon that, Madam Chair? Because I was running some numbers too while this was going on. Because, yes, while that's true at the county level, the direct allocations from the federal government to the county and the city of Sacramento bring their total direct allocation to $175 per resident of Sac County, compared to our approximate 100. When you then go back and add in the additional allocation of the local dollars under the CARES Act, it takes Sacramento County's allocation total between direct allocation to the county and the city, takes it up to $191 per county resident that Sacramento County is getting versus our $100.
Yeah.
Well, that's why I wanted specific funding.
Yeah, I agree.
I was looking for another avenue for competitive funding, but, yeah.
Yeah, I mean, I appreciate it, but I don't see it, and we need to get this amount of money. But I think, to your point, Kirk, clearly, it's a different environment in urban areas where they have different issues than we do here in our suburban rural area. And so we need to do it differently.
Los Angeles County and the City of Los Angeles each received direct allocations combining $1.7 billion, which is $173 per resident of Los Angeles County, again, compared to Placer County's $100. So they're recognizing with the dollars that the counties need to be treated differently. We're simply asking that you recognize with your policy that the counties should also be treated differently. And so that's why I'm very comfortable with this resolution. If I may, just one other little comment on the public comment that we got. The comments that we continue to get from people who are fearful and concerned, again, I understand fear, but I don't understand being so gripped by it that you are afraid to move forward in any way, shape, or form. And we have some real-world comparisons that we can look at, because while we hear from the business community that this is the situation that we're living in, this is the crisis we're experiencing, what we're hearing from other people is we're afraid that if you do this, then we might. So we as a board, once again, are wrestling with this issue of the devil we know versus the devil we don't know. And clearly we know the toll the devil we know is taken, but I found it very helpful and very reaffirming for me to go back and look at Florida's numbers as they compare to California's numbers. Not only did Governor DeSantis not shut down their tourism industry, he actually declared hotels and resorts essential services. So he didn't take any actions to shut them down. He kept them open. The market took care of it. The market ended up shutting down most of the hotels in Florida because people just didn't feel safe and didn't want to travel. But while they kept it open and we shut it down, what do the numbers actually show? Confirmed cases in Florida versus California per 100,000 population. Florida has 233 per 100,000. We're at 229. Florida stayed open. They had 4 more confirmed cases per 100,000 population. Deaths per 100,000. Florida's at 10, we're at 9. So a state that stayed open and encouraged tourism and has opened up already, May 4th, they reopened everything. We're simply not, the speculative nature of the concern about us not doing something now is not borne out by the actual numbers when we look at another state that is largely tourism dependent for their economy, having not only not shut down their hotels and lodging, but then went and moved forward ahead of us substantially so that they will have almost a month head start on reopening their state, and we just don't see the numbers bearing out. I'm very comfortable moving forward with this resolution today. I think we've got to position Placer County for success, and I think this doesn't.
Right, Supervisor Gustafson?
Yeah, I appreciate the indulgence on the resolution. I have one more suggestion, and this isn't on the final four, but this is maybe an additional whereas, and this goes to Ron Cohen's point and others' points on the economics. So perhaps an additional whereas, the lodging and tourism industry is vital to the economic health and prosperity of Placer County, and as such need to open in a safe and responsible manner.
I like it.
And that can be close to where 3 is, or under 3, or a part of?
It's in the one of the whereases.
Oh, just adding it
Right.
to?
No, prior
Oh,
to the therefore be resolved.
Right.
Thank you, got it.
Just a finding that we add there, and I'm not quite sure how to get to this, because clearly we're not at 70% reopened in communities, in some of our small communities are desperately behind that 70% threshold that the governor has mentioned. To an earlier commenter had asked about the mental health and the numbers we were able to get. While you were running other numbers, I was asking for others. Mental health calls in the North Lake Tahoe area have tripled during this time. Food delivery through the Sierra Community House is up 225%. So when we look at caseload and case statistics, as you watch what's happening with mental health and food deficits for individuals, it is very, very significant for our community. And the people that are most impacted, it's not about economic gain, it's about providing for their families. Most of the businesses have taken dramatic cuts. They're just trying to keep employees able to pay bills and able to put food on the table for their families. So especially in those small communities and in small businesses, it's often the difference between survival and not. And so I want to make that clear. I'm not supporting this because of economic gains or county revenues. This is about community members who are dramatically suffering. This is a really divisive issue throughout. We have individuals, and we've said this before, extremely concerned about their own health and don't reopen, and those who say throw the gates open, we shouldn't pay attention. I understand it's divisive, and this is, for me, not political. It's looking at common sense guidelines for types of businesses. I personally believe our small business owners are better able to provide a safe environment than big box stores, and yet big box stores and home delivery services are making huge profits. No one's asking them to give back, and I know many of them are in some ways, but they're having record-breaking profits, and yet some of our small business people are losing everything that they've worked their whole lives for. And I think we need to continue to remember that and honor that and realize that people have a personal choice. Whether they go out, right now, whether they wear a face covering. Some businesses require, others don't. Those who are at risk, shouldn't go out and should wear face coverings and take all those precautions. And I would urge everybody to be cautious. Don't get close to others, and take care of yourself and take care of your families. But looking at this resolution, I have continued to push for we need clear guidance. While we've been on this phone, I heard barber shops and beauty salons were announced to open today. And this is how we are hearing as we're trying to make local decisions that impact our local businesses. We hear because of a noon press conference, not because the county gets any heads up, that our leadership is consulted. It just happens. And I don't know if it's statewide yet. I haven't had a chance. We've been in the meeting. But that is what's been frustrating, I think, to city leaders. I know in Auburn, the mayor and I have talked about the changing dynamic of every day a new announcement and something new to react to, and you spend time, our county staff has spent a huge amount of time working to provide guidelines to businesses that are then all of a sudden changed or redirected, and I feel a lot of our energy has spent counterproductively because the state has come out with new guidelines or new thresholds, and that's been frustrating for us all. But we continue, that's our job, to continue to try to work and make it the safest return and to keep our businesses moving forward. For the tourism industry, I wanted to say a couple things. One is, I've repeatedly said this, we started closing businesses before we were asked to. And we canceled 4th of July and all special events. We understand large gatherings are hard to enforce at. Those types of attractions aren't necessary. But lodging in small hotels and motels and individual homes, if a second homeowner or a part-time resident can come, or a Forest Service campgrounds opened this weekend and we're packed to the gills and turning people away, how is it not safe for others to come and be just socially distant physically distant from people in small lodging? And again, I'll reiterate that I think our small business community really can provide a safe and healthy environment for their customers. We are not the first county to ask to go to stage 3. I reported a week ago that San Diego Board of Supervisors did this, so I don't want our residents to think that we're out there ahead of everyone else. Actually, San Diego County is who I got the idea from and brought forward, is that they had already requested going to stage 3 and opening up some forms of tourism. Nevada, for those of us on the eastern part of the Placer County, we live, as was mentioned by one of the callers, right next to the state of Nevada. Lodging is opened already, and they're going to open the casinos June 4th. Given this weekend, I can tell you, people are there, and we need to deal with them and have every resource to educate and ask them to use safe practices. I want to commend the county staff, the Take Care program, the posters that were up throughout our community at beaches and gathering places, asking them to be physically distant, to wear masks where in closed areas, and to really take care of themselves and use that personal responsibility. So I'm going to support that for all those reasons. I'm sure there's many more that I'm not gathering my thoughts completely about, but this is not that we're not following medical advice. We're looking at those statistics, we're looking at the guidance. I want to continue to get reports from our health officer on what we're finding out through the contact tracing, how these people came into contact with the virus, and what we can do to further educate our businesses and our community members how to protect themselves. Thank you.
Supervisor Holmes?
Thank you. I just wanted to pick up on what you mentioned about mental illness. It's very concerning. There's kind of a malaise over the whole population under this lockdown. It's affected me. I don't know if you noticed yourselves about not being able to get out. What? But I serve on the Mental Health, Drug, and Alcohol Advisory Board, and child abuse reports are down. And the reason they're down is because schools are closed, and there's not enough eyes on these children, these kids. That's why it's important for them to get out and do their sports things. And the interesting thing is that the emergency rooms are getting more child abuse cases, because by the time they get to that point of abuse, they need to go to the emergency room. So that's just another sad concern that I have about this. So we need to get these kids out of the house so they can run around and people can keep an eye on them and see if there's been any kind of abuse. It's just one of the things that grind on me as much as any of the others. Thank you.
Thank you. I just want to make a couple of comments, and as Supervisor Gustafson said, we hear both sides of this issue, and people are very passionate about it. And I think folks need to know that we are concerned about protecting the most vulnerable. That's what we have been doing now for the past 2.5 months, is making sure that people are protected and taken care of. And we anticipate that a spike will happen as we open up. Everyone has said that, and we know that that will happen. The good news is that we're well prepared to address those surges. Our hope is that those surges aren't huge, and we have to continue being kind to one another and taking precautions and washing our hands and doing all of that really important stuff. But there's also a balance between protecting human life and protecting the other parts of life that are really important to folks, which is their economic health and their mental health, to your point, Supervisor Holmes. As I've been looking at the numbers of how this has affected our residents when it comes to economics, I sat in on a call last week, and the economics of this, unemployment in our region is now at 42% or 14.2% versus what it was about 3% before. So it's increased dramatically, but the unemployment is it's adversely affecting those residents who are under 35, women, and people of color, because those are the folks who primarily serve in our hospitality and our service industries. So the people that are hurting economically are people of color, are women, and people under 35. That's terrible. These are the folks who are standing in the food lines and who are stressed out with their families. And we have to consider those economic impacts on our community as well, because that hurts people's mental health and physical health in other areas as well. So I think that our county has done a very good job of putting together guidelines for businesses to open up safely. We want businesses to open up safely, but we cannot continue to keep our businesses from opening up and hurting the economic well-being of our community. It's just so important. So this is a balance, and we're advocating for something that's really important to our community, because our numbers have been low, and that is a terrific thing, but we can't just keep our county closed to protect every single life. That's just impossible and not realistic, and every life is important, but we can encourage people who are vulnerable or who work with the vulnerable to take measures to protect themselves. So I think that this is well thought out. We've worked really hard to get to a place where we can advocate for our community to open up, and yes, County Council.
Oh, I was just waiting for a time afterwards. If there is consensus in adding Supervisor Gustafson's recital, I'm going to suggest right before the last recital and ask Supervisor Gustafson to read it again so that we make sure we have it accurately.
Sure. Whereas the lodging and tourism industry is vital to the economic health and prosperity of Placer County, and as such, need to open in a safe and responsible manner.
And as you do that, I'd like to add one whereas clause under the last whereas, where we've got hail and nair salons, gyms, movie theaters, youth sports. I think we should include youth sports and programs in that whereas, since we refer to it later. So if we could just add that, youth sports and programs. All right. Thank you for the robust discussion.
Second.
All right, I have a motion by Supervisor Euler, second by Supervisor Wygant. Let's go ahead. I don't think we need a roll call, do we? All those in favor signify by saying aye. Aye. Opposed? Motion carries. Thank you very much. All right, we have another item I would like to propose. Would you all like to take a 15-minute to 20-minute break? Let's come back at 1:30 so that we can take a break, and we'll be back at 1:30 to address the last two items on our agenda. Thank you. Wonderful, we are back, thank you. We are going to now move to our item 3A, which is the COVID-19 study. I'm not even going to say the word. Go ahead, Dave.
Dave DeFonte, CEO. Good afternoon, Chair and members of the board. So before you today are two actions requested should your board want to conduct a COVID-19 seroprevalence study in Placer County. The first action would be authorizing the CEO to sign one or more agreements as necessary with counsel and risk concurrence up to an aggregate total of $250,000 for contracts that would be necessary to conduct the study. The second would be directing CEO staff to work with HHS and our public health officer to take all actions necessary to conduct the study, and we'll talk about that in just a moment here. So first, a bit by way of background. On May 5th of this year, your board directed CEO to work with the public health officer on a potential study. So since that time, we've been working very diligently on identifying a process, partners, as well as necessary expenditures to put that study together. And then on May 19th, Supervisor Wygant provided your board with an update as to where we stood at that point in time. So those efforts to date have helped frame up a study that would test a representative cross-section of Placer County residents for COVID-19 antibodies to assess current COVID-19 prevalence in the county. This study would intend to help the county and community better understand the spread of COVID-19 within the county, to set a baseline, a current baseline by which we compare against in the future, should we want to do updates to that study in the future, and then also help inform the board's policy decisions moving forward. So the staff report provides a high-level overview of the tasks as we know them today that would be necessary to conduct the study. I'll just give a very brief overview here right now. We would contract with a qualified consultant to identify a volunteer participant pool that represents a statistically valid cross-sample of Placer County residents. We would engage an institutional review board to ensure, both in advance and throughout the process, that appropriate steps are taken to protect that volunteer participant group. Third part, we would collect and process tests from those participants. There's two options outlined in your staff report. The second option is where we're currently landing in our thought process. That would include engaging a local private entity. The staff report notes it could be Quest Diagnostics or another company like that, whereby we would send those participants to pre-existing locations to have them tested, those tests processed, and then those test results sent back to the county and others as necessary for analysis. The public health officer would order the tests and receive the results for analysis by Stanford and others. We'll talk a bit about Stanford in just a moment. We would propose, as we have been in the last couple of weeks, coordinating with Stanford affiliates and other qualified institutions to analyze and summarize the test results for your board's consideration. We would also provide feedback both on the front end as well as the back end for those qualified individuals and institutions to help inform the process as well as analyze the results, just to make sure that we have that adequate peer review on both the front and back end. So obviously these tasks are fairly generally identified at this point. They would need a bit of further refinement as we set the process up, should your board be interested in doing the study. So the staff report also provides a budget estimate. Again, these are task estimates by task. Most of the estimates are ranges because, again, we have a little bit more digging to do to refine exactly what these might be. But for the marketing consultant, we think it's somewhere between $100,000 and $200,000. And that estimate is based on a very similar process that was done in another county in California. Stanford affiliates assistance to help conduct the study and analyze the results. We're thinking somewhere between $10,000 and $20,000. We have a range here between $10,000 and $50,000 just to be very conservative. Third would be a medical consultant to help minimize HHS and public health officer workload. Obviously, they're very busy with other things, and we want to be as mindful as we can of their time. So this consultant would help to offset some of the workload that might otherwise fall on their shoulders. We have the IRB costs in the neighborhood of somewhere between $5,000 and $10,000, and then conducting and processing the test results. Again, with option 2, we think that that amount will be very minimal, in that federal law under the CARES Act currently requires those tests be covered for folks that are insured. So the county's out-of-pocket would only be for tests for folks without insurance to make sure that they could be tested without any cost out of their pocket. So the fiscal impact for the study to the county, we don't believe there would be any general fund impact. Obviously, a lot of conversation this morning about the CARES Act funding. When that comes through, we would be talking about using approximately $150,000 of that funding for this study, with additional funding coming from other community partners, as Supervisor Wygant had alluded to last time we were here. So with that, happy to answer any questions.
Thank you, Dave. Supervisor Wygant?
Yeah, if I could just, I want to be as brief and accurate as possible, but don't laugh, Kirk. But obviously, you know, for me, this caught my attention because I think we're so thirsty for information, and we just got through spending, I thought, some really good time talking amongst ourselves about how we have this burden now of considering more intensely the whole health of the county, COVID-19 related and otherwise. So the first thing I want to do is extend a huge thanks to Dr. Sisson, who I'm assuming is with us. But she actually spent over an hour, more like an hour and a half yesterday with Shanti and I up here on Memorial Weekend, and we were able to drill down on some of the details, and that's really what I wanted to share with you today as we look at Dave's staff report in front of us. So before, we were talking about a sample size of 1,000, which Dr. Parsonet from Stanford acknowledged would give us good accuracy. We would learn with a high degree of accuracy the rate of spread at a particular point in time in Placer County. And if we then added the marketing and did the statistical filtering, we could get a really good understanding of how that occurs within our communities within Placer County. So if there's a difference between the tourism-based side and others in communities like Forest Hill, Sheridan versus Roseville, for example, which I think would be meaningful in the event we wanted to do it again. But we did never statistically start from, Dr. Parsonet had 1,000 samples to give us, which is the option one, and that we kind of let that lead the definition. So what Dr. Sisson did yesterday for me is prepare a several-page discussion of how, if you were really starting from the point is, what would your sample size be if you were trying to get a certain kind of information with confidence, particularly as it relates to things like mortality rates. Her calculations take you to something like 2,200, and it wouldn't double our cost at all. It would add to them, but it was a very logical and sensible, and for people like me, it was interesting to just read as well. So I want to again thank Dave and Shanti and Dr. Sisson for their time, but I did want to finish by thanking the people who had committed to contribute to this effort and just give them public recognition. So this started with a conversation I had with United Auburn Indian Community. They offered to contribute Adventist Health, AKT, Mike Fournier of BEM, John Moyer, JMC Homes, Holly Tosh, Placer Ranch. And there are a couple of three others who indicated that if the board agreed to approve this, that they would almost certainly participate, but they wanted to leave it at that. So with that, I will be quiet.
All right, I have a quick question, Robert. So how much do you think, based on public, or not public, excuse me, private giving, you think we could raise?
I think there are a lot more people out in the public who would contribute if we really worked at doing that, which I would be happy to do it. I'm understanding that of our $40 million, those costs could be included in something like this. I would personally pay for it all out of the county if it came to that, but that's, I don't know what the upper limit would be, but I certainly could see the private sector contributing $100,000. Because Shanti was one who actually made most of the calls and reached out, and we just thought it would be something to bring back to the board last time we had that conversation.
Right, and I think that the moving to more of the number that Dr. Sisson mentioned, the 2,200, to give us a much better understanding, I think is terrific, and especially if you can augment the cost of public or private health care. That's really helpful, and as much as we can use out of the CARES dollars, once we get those CARES dollars, I think that would be terrific. We've got some questions. So Supervisor Holmes?
I'm still trying to figure out what the public benefit is here. What are we trying to approve to the public?
Well, I'd be happy to take that or defer to Supervisor Wygant, but at least from my perspective, there's been a lot of talk about better understanding how the county has been currently affected and arming your board with that information to, as you're required on almost now a weekly basis, if not more often, to make policy decisions relative to the COVID outbreak. So having a really solid, statistically valid cross-sampling that we can all agree to at the end is good information to run with. I think the hope is that that would help arm your board with better information for making policies from, as well as creating that baseline where we know that as we open up, as was raised before, that we do run the risk of a bump in cases. So by doing this study now, we establish that baseline from which to compare in the future. If we do start to see a bump, either a couple weeks from now or maybe in the fall as cold and flu season comes back around.
So how long does this whole process take?
Good question. So we've heard some of these processes being done in as little as 2 to 3 weeks. I would think that it would take a bit longer than that, but we're measuring it in weeks, not months.
Here's my challenge. The staff report says no more than $250,000. But it also says there should be no net county costs, but we have Dr. Sisson, your time, Jeff Brown's time, staff, and we anticipate using $150,000. And additional funding come from community partners. But up top here, the budget estimate has a broad range of estimates. And if you add up to $200,000 for marketing consultant, $50,000 for Stanford affiliates and others, that comes up to $290,000. And so I need more information about what we're doing here and why we need to go forward, because I think that the $250,000 is just the entry fee. We're going to go on, and this is going to raise the cost as we go on. And I still don't understand the real benefit of going forward with this.
Did you want to share, Robert?
Yeah, and for the public too. Some specifics I think that the public and all of us would learn would be that when I first, this caught my attention, it was because of the work that had been done at Stanford and then USC, where they learned that it was very likely, almost with a high degree of accuracy, that the spread rates in those places were 20 to 85 times higher than the documented cases. The implications of that are huge. And if you think about where we're going with all of this, we started with no infections, and depending on what you read and what you study, we could have herd immunity at 50 to 60%, perhaps 80%, but that's where we're going, or some semblance of it. If a vaccine is successful in being created, that will hugely accommodate getting to herd immunity. But I just read a thing over the weekend, or heard a presentation over the weekend, whereby this person makes a very intelligent statistical argument that maybe it's more like 20%. Dr. Sisson and I had a chance to just talk about that a little bit yesterday. So then we get to things like what we're doing today, spend most of our time, we're encouraging, we're just making decisions about what we think should be open, how we lobby the state for those kinds of things. We're trying to compare how that exists down here as compared to the tourism-based part of our economy. Several months down the road, we might be discussing, depending on what does happen in terms of bumps or not, do we make recommendations as it relates to major sport events, or participate with the school as it relates to studying those kinds of things also. So if we did it again 2 or 3 months from now, and let's assume, for example, most of the experts seem to think that the spread here in Placer County is 1.5%. So let's say it's 10% 3 months from now, or let's say it's more like only 5%. We get a handle on how this thing is rolling out within the county over time. All, to me, essential information for trying to create policy as we go forward.
Thank you. Questions from Supervisor Euler?
Yeah, I appreciate Supervisor Wygant spending the time and bringing this forward. The recurring theme that we hear from folks who are opposed to, well, the resolution that we just had, is fear. And the best way to combat fear is with information. And I think the more information that we have that is specific to our community and the prevalence of this disease within the community, and then how that then subsequently manifests itself in terms of hospitalizations, deaths, all the rest, is going to be the best way to get people over their fears that this thing is creeping out there beneath the surface just waiting to strike. My belief is it's already struck. And I do believe that we're past the majority of it, and which is why I've been consistently pushing on us reopening the economy moving forward. So I think it's important for us to gather whatever data that we can, and in spite of the fact that it's affiliated with Stanford, I am enthusiastic about moving forward with it. The other thing that, while I understand Robert's desire to mitigate the direct county cost, I juxtapose that with the other criticism that we were under, and that is that we only care about the dollar, and this is all about big donors who are just trying to get us to reopen the economy and all the rest. And so it seems to me almost that we could be accused of biasing the sample if we were to be accepting contributions from the private sector to help pay for this, because if it shows the kind of data that I think that it's going to show, then people say, well, yeah, but that was all because you paid for it using your big donors' dollars. And so I would like to keep this pure institutional / government research funded and see what the data actually is. That's my preference.
Thank you, Supervisor Gustafson.
Question, then I'll make a comment on that. First question is, under the budget estimate, you say a marketing consultant. Really, in that, I think you're talking about a polling consultant or a statistical consultant. I mean, I think when you say marketing, it sounds like it's promotional.
Right.
And I think what you're really looking at is statistically, those who analyze statistics for potentially marketing purposes, but in this case, they would be doing that for us, for
Correct.
making sure we have an adequate sample and it's statistically valid, correct? So I'd call it a polling consultant personally, but that's just.
Yeah, so just,
Or is-
it's a marketing firm that would do that kind of
Right,
polling work. And the
right.
way that should be done is that there would be a meeting, a conversation with Dr. Sisson, the Stanford team, and a marketing firm that does that, and then they would winnow down to within detail exactly how they should calculate the sample size,
Right.
et cetera.
Right. Good. Second thing is, we've known, certainly throughout this pandemic, but throughout our careers, that medical experts disagree. Quite often, actually. And so I want to make sure that when we say work with Stanford and or other qualified institutions, as well as Dr. Sisson, that we have as many resources in our community recognized, whether it's Kaiser or Sutter, some other expertise participating in review of this. So it does have that credibility that Supervisor Euler was just talking about. Whether we pay them or whether they just volunteer to serve on an oversight, so that really there's as much credibility to the efforts we're doing, so there's no disagreement between various, there will be disagreement, but that we come to some compromise both on the numbers and the strategy for how we're going about that. And then we can have validity to it with our public, because I agree, no matter what we do, some people may think that the marketing consultant or one institution over another did something different. So that independent review board or other advisors, so that we really have as many signatories to the outcomes as possible. And then I want to make one comment to Supervisor Euler's about accepting private contributions. I tend to agree. If they want to contribute, maybe they should contribute to our local food banks or other efforts that are necessary right now, and that we fund this independently, hopefully taking some of that bias out of it. And with the CARES Act funding, assuming we get the CARES Act funding, I think the $250,000 to me is reasonable. to show the independence.
Thank you. All right, oh, I guess we need to open this up to the public, don't we? All right, why don't we do that? We've asked our questions. We will now open this up to the public. We just ask folks to keep your comments to 3 minutes or less. Thank you.
Good afternoon. Please state your name for the record.
Hi, this is, sorry,
Do you want to let her know there's feedback?
Are you turning off your audio in the background? Okay.
I just did, thank you.
Go ahead.
Yeah, so I have some questions about this issue. First of all, there's been lots of arguments out there about the test being proven to be unreliable with false positives and negatives. And the CDC says that the testing of those infected is more important for contact tracing and seeing how this is spreading in our community. And also that it has not been proven that if you have antibodies that you would be protected from getting COVID again. It has been known to mutate rather quickly. So spending $250,000 on serum testing when I think that that money could be used in our community to help those people that are struggling, I think that would be a better use. Also, I wanted to mention earlier, Supervisor Gustafson said that wearing a mask to stop those that are unknowingly spreading, actually you didn't say that, you said that the people that are afraid of going out should just wear a mask or stay home. And the fact of the matter is that the person wearing the mask that has immune issues and goes out to a pharmacy to pick up medication or goes to the grocery store, they are not necessarily the ones spreading the virus. And it's been proven that if people that are asymptomatic and have the virus and wear a mask, that they're the ones that are that's going to help stop spread to the people that don't have it. So that comment about just go and wear a mask when nobody else is wearing a mask does no good for the person that is wearing it. So I just want to point that out. And then also, Supervisor Euler just said that he believes we've already had the spread in our community, but belief is not facts. And the testing has come along so late for testing people with this virus. And again, the CDC saying that is most important for contact tracing. I don't really see where this is beneficial. And then also, Supervisor Wygant also just said that this is something that you would repeat over and over throughout the week. And by the time this actually got started, and then we waited several weeks to get the results, and the community already pretty much is open because people are ignoring any kind of mandates, that the results really aren't going to be beneficial in any way. And then if you have to repeat them every couple of weeks, is that $250,000 going to cost us every time you repeat these tests? So those are my comments, and I'd like to see if you guys have any responses to that. Thank you.
Can we get your name for the record, please?
Yes, sorry, Lisa Larkin.
Thank you.
Thank you. Next caller,
Thank
please.
Good afternoon. Please state your name for the record.
Yes, my name is Kathleen Crawford, and I am calling again this afternoon after your brief break. I really am concerned about spending up to $250,000 of county taxpayer money on a potential that may give us information 3, 4, 5 weeks from now that will not really provide much in terms of additional data as to what we would be doing here in Placer County. So my concern is that if we have a spare $250,000 in the county budget, that instead be redirected to some sort of grant program to our truly small businesses, and give them a grant or a small low-interest loan that would allow them to help meet their needs. And that would be much more in line with what is needed immediately, according to most of the people that we've heard from in the Lake Tahoe tourist industry. So I am opposed to the study. I am not generally opposed to studies. I generally think more information is better, but I'm skeptical that this is going to prove to have information that is really going to make a difference in our county. Thank you.
Thank you. Next caller, please.
No more callers.
No more callers? All right, thank you. All right, we'll bring it back to our board. Supervisor Gustafson?
I had one more question that I forgot to ask. You mentioned other counties. I know Santa Clara did an early study. There was another county that you mentioned, or
Yeah.
are there others?
LA, Orange County, I'm sorry? Alameda County, yeah, a couple of few Bay Area counties that we've heard.
Lane County in Idaho, which is Sun Valley Ketchum,
Yeah.
they had an interesting spread for a range of reasons, but because of the tourism-based economy, they were talking about doing one. Don't know the status of it, but
Yeah.
there are actually several.
Yes, sometimes I think when we're talking about doing things, people don't realize how many others are actually trying to get the same kind of data, and that the more types of counties that do it, the other ones we've mentioned are not rural counties, so that could be an interesting dynamic. And the caller was absolutely right about masks, except I know that if you have significant immune issues, you can get prescribed an N95 masks, and they are becoming available, and those do protect you from others. So just wanted to make sure I was clear about that for the public record.
Thank you. All right. Other conversation? Supervisor Holmes?
Those other counties that you mentioned are large populations and a lot more urban residents. And so it seemed to me that it would be more appropriate for those counties to do this. I don't see the wisdom in moving forward with this. Our population, we've been talking about, there's only 9 deaths and there's not as many people infected. And it makes no sense for us to follow this governor's guidelines. But then we were going to do a study like this. It's, again, the $250,000 is just the entry fee. It'll be going more and more as we go through. So I just can't support this unless I have more data.
Thank you. Other conversation, I appreciate the comment about public dollars versus private dollars. And I'm all for asking for private dollars to help do things, right? Because government, can't always shoulder the cost alone. And I think that to Supervisor Euler's point about information is power, right? Having that information to guide us in the future, I think, is really helpful. And so I'm okay with saying, hey, if there are some businesses that want to contribute to this, we can limit we can lessen the amount of impact on our county funds. I mean, these dollars are dollars, hopefully, that we're going to get from the federal government to actually address COVID type things. But if there are private dollars that we can augment with that, I'm always for public-private partnerships. I understand the concern about people thinking these businesses are buying their way into opening up, but that just doesn't hold water. I think people want to know how this is affecting us. If we've got antibodies, how we can move forward in the future. I think it just gives us additional information. So I would like to see if we can get additional funds. I wouldn't want to go higher than the $250,000 from the CARES dollars, but if we can even keep that less, I think that that's helpful.
I would agree with both of you. No, I would agree. I think if we have the right oversight, then we should be able to deal with this issue of, did the private sector in any way sway the results? So proper oversight is really the key to me, making sure that there's validity that comes out of spending any amount of money on this.
Let me just clarify one thing as well. Part of this, the funding, is an institutional review board. This is kind of what you're referring to, an independent review board that actually makes sure that the information is statistically valid, gets out of the biased perspective or perception that may be out there. So I think part of this is utilizing a third party to address and help with this study. You want to add to that?
Yeah, we've had a number of conversations with doctors from a variety of organizations. So I think, as Supervisor Gustafson alluded to earlier, making sure we have multiple perspectives involved up front. So when we have the study completed, we can all accept the results as meaningful, and as accurate as possible, given how the study is constructed. So the IRB also comes into play, absolutely. It's an independent third body, and we'll really be looking at making sure we're treating those participants fairly as well. Because obviously we want to all feel good about whatever information is generated from the study. We also want to feel good that we're treating the participants fairly and honoring their information and their volunteering to be a part of it.
Yeah, thank you. And then to Supervisor Holmes' concern, and I do understand it, but we are a rural community and we do think we may be different, but we don't know. And if these other more urbanized counties are doing similar studies and then our numbers are the same, maybe we aren't. So making sure we understand where we fit in this weave of reopening and COVID spread, so that we can best protect, as Supervisor Euler said, fear comes from not knowing. And the more we know, the better we can address this and inform our public of how much the spread was and where it may continue to go, especially as we enter into next flu season. So,
Supervisor Euler?
Oh, I'm sorry, that was on for previous.
Okay. Supervisor Wygant?
Yeah, just one point and then some other detail that I think worth mentioning. I'm flexible on the funding partnering or not. I mean, to me, it makes sense to try to offset the public costs. But I want to point out something that Kirk raised, which is the United Auburn Indian community doesn't even have to talk to us. They comply with a federal process. They hugely are invested in being able to reopen successfully, safely. But their motivation has nothing to do with getting information that is going to make it easier for them to deal with the county, because they simply don't have to. And then in conversation with Dr. Sisson yesterday, there are two options in the report that referred to how the study would be done. So one is the lateral draw pinprick thing that came from $1,000 or 1,000 kits that was offered from Stanford. I think everybody agrees that the Quest blood draw test is a better way to go for a range of reasons. Dr. Sisson yesterday clearly stated that, and in addition, feels much more comfortable specifically with the Abbott test, and Quest has the ability to do that. So as far as I'm concerned, Dave and Shanti may have some comments, but if we're going to go down this route, focusing just on option 2 and even with Abbott was something that I thought I needed to share.
Great, thank you. All right. See no more comments. Do we have someone who wants to make a motion?
Yeah, I'll move that we approve the item. I appreciate the thoughts in regard to including private sector donations to the extent that we're able to receive them. I'm comfortable moving forward with the 250 kind of as a starting point, and then seeing where, if we think that the data set is enhanced by additional tests and we're able to raise some money for that to supplement, then I'm fine with that. But I think our action today would not preclude that from happening.
Okay, but did you say 250,000 as a starting point? Because right now...
No, I'm sorry. In order to get us going, that's our commitment from the public sector side, and I feel that we can get substantially enough data in order to justify it with that, to the extent that we want to enhance it by trying to raise additional dollars privately in order to increase the sample size. I'm fine with that as well, as opposed to my previous concern. Okay. You guys have talked me out of my previous
All right, great, thank you. All right, so we have a motion from Supervisor Euler. Second. And I'll have a second from Supervisor Wygant. All right, let's go ahead and all those in favor, or do we need to do a roll call?
Probably
no?
roll call.
All right, all those in favor? Aye. Opposed? No. What, motion carries 4-1. Thank you very much. Appreciate the conversation. And we look forward to moving forward with this action, seeing how that comes about. Thank you very much. All right, and we're going to move to item 4A, which is the urgency ordinance to reduce outdoor retail regulations and sign requirements. Hello, Mr. Pedretti with a beard. Nice to see you.
Yes, Steve Pedretti, the Director of the Community Development Resource Agency, long overdue for a shave and a haircut. Hopefully both will happen pretty soon, so be that as it may. We are here today to bring forward an urgency ordinance to help businesses deal with some of the impacts of the virus. Specifically, we're looking for a temporary ordinance that would allow retail and restaurants to use some outdoor areas to help them offset the impacts of social distancing. Obviously, with the restaurant, the tables are going to be closer than 6 feet in most cases. Makes it difficult for a restaurant to be viable without having all their tables. So this would allow them to move some outside and help them out. And same with retail. We're also going to allow some signage that on a temporary basis that we wouldn't normally do. This was put together very quickly. In fact, it was just barely over a week ago that we got a group together to work on this, cooperative with Cedra County Council. Thank you, Karen, and the CEO staff. And we pulled this together. We have come up with some criteria. I just want to stress that with all things COVID related, a little bit of flexibility in the implementation is going to be very important as we move forward. One thing that I noticed is that I had intended this to be an administrative approval that would be no cost. I did not get that into the ordinance. We didn't discuss it. And so that's one thing that we will maybe want to talk about at the end of the presentation. Alex Fish from our planning division will be making the presentation. I'll let him go ahead and get started.
Thank you, Steve.
Good afternoon, Madam Chair, members of the board. I'm Alex Fish with the Planning Services Division. And as Mr. Pedretti noted, I'm going to go over some of the specific provisions in brief and then can answer any questions you all have about those. This urgency ordinance would temporarily reduce provisions of the zoning code pertaining to conduct of outdoor retail sales, outdoor restaurant dining areas, as well as restaurant parking provisions. And as Mr. Pedretti mentioned, would also temporarily reduce some of our restrictions on signage. The first code section that is affected is pertaining to section 1756-160, outdoor retail sales. County code presently allows any approved retail establishment to display, use an outdoor area no more than 10% of their indoor retail sales area for outdoor display. That outdoor display is not permitted to be located within any parking area. Under the urgency ordinance, outdoor sales would be permitted to occupy an area up to 100% the indoor area if that space exists outdoors, and up to 20% of the required parking spaces for the business could be utilized in service of that outdoor display area. The next provision is pertaining to section 1756-190, outdoor dining areas for restaurants. In all of our commercial zoning designations that allow fast food restaurants, they're permitted with either approval of a minor use permit or a conditional use permit, whereas in many of the commercial zoning designations, traditional restaurants and bars are permitted with zoning clearance. And what zoning clearance means is not only checking the standards of the applicable zoning code, but going through a design review approval process as well, typically if it's a new establishment that's building or changing the exterior facade. And we apply the same standard to outdoor dining areas. Under these provisions, that would be relaxed to just a zoning clearance procedure, validating the ability to provide safe access to the establishment, not obstructing ADA paths of travel, things like that, in those zoning designations where a restaurant can be approved by zoning clearance. In those instances, like for a fast food restaurant where they would go through a use permit process, they would instead be subject to administrative approval, and that's just a zoning clearance procedure managed at a staff level and ultimately approved by the planning director. Mobile food vendors, I should mention,
Presently, where they're allowed to set up their operations as an operational base, they're approved by minor use permit. They would also be able to take advantage of these provisions and just go through the administrative approval process. Would be a very efficient, fast process. So if they had the permission of a property owner to, say, locate in a parking lot of a shopping center and take up 4 or 5 parking spaces, we would be able to review that rather quickly instead of sending them through the entire use permit process. A companion aspect of this is Code Section 1756-190, and this is pertaining to restaurant parking provisions. Typically, when they implement outdoor seating areas, they do have to prove up additional parking area to meet that increased demand. As you all know, with the California Department of Public Health guidelines requiring social distancing, a lot of the capacity within those restaurants has been displaced. And so with the inclusion of that outdoor opportunity, we would be able to offset with those existing parking spaces that we already have. Also allow for some flexibility to potentially utilize some of those parking spaces. I'm sure you all have probably seen instances where a restaurant has a couple of easy ups. They set up a kiosk outside to either facilitate their delivery services or their drive-up customers. I think we anticipate seeing some more of that potentially coming forward. The last 2 provisions are pertaining to signs. The next one is Code Section 1754-170, Section 3, and this is pertaining to signage for temporary sales and events. Presently, we do allow for air-inducted signage, blimps, things like that, banners, but only on a temporary basis to advertise a sales event or some specific activity for a limited duration of time, 45 days per calendar year. We're proposing that for the duration of this ordinance, that would be suspended, and so they would have an additional 45 days of that outdoor temporary advertising opportunity. We know our business owners tell us all the time that their best opportunity to connect with the public, attract customers, is that on-site advertising opportunity, and so allowing some additional flexibility in that could certainly help with the recovery from the COVID crisis. Lastly, the final section is Section 1754-170, Section 4D, and this is again pertaining to a very similar section of the sign ordinance about prohibited signs and materials. A-frame signs, also called sandwich boards. You often see those in front of restaurants, advertising daily lunch specials, happy hour, things like that. Those are actually prohibited in our code. We would permit those along with things I already mentioned, the air-inducted signs that are meant to grab your attention, a balloon, a blimp, something like that. But these are things that would not be permanent in nature. Of course, they are temporary, they're movable, and can be easily taken down and removed when the duration of the ordinance has passed. As I conclude my presentation, I did want to note, in our view, the fiscal impacts of this action. They're assumed to be fiscally positive to the county, to its businesses and residents, and will hopefully assist in the economic recovery from the COVID-19 crisis. No new or additional funding is required to implement or administrate this urgency ordinance. I should also mention that this action is exempt from the California Environmental Quality Act because it would not result in any new construction of facilities that would have the potential for causing a significant effect on the environment. And lastly, as I said earlier, this ordinance would be effective immediately and would last for 45 days or until July 10th, 2020, in accordance with Government Code Section 65858, which does have a 45-day limitation. However, it does allow for an extension of that period through subsequent board action at a public hearing. And if you have questions or comments, I'd be happy to address those items.
Great. Thank you very much, Alex. Supervisor Holmes?
So this ordinance is countywide. The cities that have restaurants are comply with this?
The incorporated cities would not be subject to this urgency ordinance, correct?
Supervisor Euler?
Oh,
No questions? Supervisor Gustafson?
No, it's been very successful in Old Town Auburn. This past weekend, I heard great reviews of what they've done with hay bales and letting people kind of spill outside, and also the town of Truckee. So I'm thrilled staff responded this quickly and is worked on it. I know you've worked tirelessly to come up with a menu that gives some flexibility. I do think there's some public that want to comment, or at least some restaurant owners that I had talked to this morning. I want to wait and see what their comments are as well.
Great, thank you. Let's go ahead then and open up to the public.
Good afternoon. Please state your name for the record.
Hi, good afternoon. Jeffrey Hentz, North Lake Tahoe Resort Association. Thank you, Chair Gore and Placer County Board of Supervisors, for the great work again you all continue to do for our community and leading us through this pandemic. We're supporting the agenda item 4A, the urgency ordinance to reduce outdoor retail regulations and sign requirements. This goes a long way, will certainly help our restaurant retail sector at this point without our lodging sector open and the visitor traffic challenges that possesses for our retail and restaurant sector. This would help both our struggling retail and restaurant sectors to offer much needed help in driving additional customers and revenue and relaxing some of those ordinances. Again, thank you for the great work, continue great work, and appreciate it.
Thank you, Jeffrey. Next caller, please.
Good afternoon. Please state your name for the record. Oh. Please turn off any audio you have in the background.
Try that again.
Caller, can you turn off any audio you have in the background? Yes, we need you to turn off any. Not a problem.
I think you'll be happy to know that I actually agree with this one. So there's been some, some data on the fact that being inside of a restaurant, that ventilation systems and fans and things like that can readily spread this. So I think that additional outdoor seating is a great idea. It gives these restaurants some additional seating spaces for their customers. I would like to know whether or not this also entails them installing some sort of outdoor hand washing station, since they would be seated outside and not necessarily going inside to the restaurant. Those are my comments. I do support this and for the signage as well.
Thank you for your call. Next caller, please.
That's all the callers we have.
And that's all the callers we have. All right, thank you. We'll bring it back to our board. Any other discussion? Supervisor Gustafson?
Well, I think Mr. Pedretti had mentioned no cost, and I'd love to see that included, as in this ordinance.
So because this is an urgency ordinance, believe it or not, we're allowed to make changes during this particular proceeding. If you want to consider a waiver of the administrative approval application fee, what you could do is to amend section 6 of the ordinance, and that is on page 18 of your packet. And I could read it into the record for your consideration. The director of the Community Development Resources Agency is authorized to waive the administrative approval application fee and directed to adopt such administrative procedures as may be necessary to implement this ordinance.
Okay. Thank you. And then my only other comment is, again, it's for our business community to operate safely for their patrons and their staff. And again, I just, everything that we're doing puts tools in their hands to make it a safe environment for both their staff and their patrons. So I appreciate all the effort.
Supervisor Euler?
Just want to say these are great steps forward. Thank you very much for listening to the business community in developing these recommendations. Clearly, as various businesses begin the process of opening up, they are going to discover new obstacles in their operation that they haven't had before. So I hope this isn't the last time we have the opportunity to review these kinds of changes that we might make that might be able to make it easier for businesses. But this is a great start, so thank you guys very much.
Thank you.
And I think we should waive that administrative fee. So if there's agreement there, terrific. Let's make sure we include that. All right, with that,
Second.
motion by Holmes, second by Gustafson, and we'll do a roll call, please.
Wygant. Yes. Holmes. Yes. Euler. Gustafson. Gore.
Yes. Motion carries. Super, thank you very much for your quick work on that. I know that our business community will really appreciate the flexibility that they have while remaining safe and keeping their customers safe.
Wonderful. And I should mention, we anticipate having information up on the Community Development Resource Agency website and the Planning Services Division website for this. I was hoping by the end of the day today, probably lunchtime tomorrow.
Terrific, thank you very much. All right, it looks like let's see, item 5A, I think we're going to pull from the agenda today. Yes, Karen?
Yes, although I was working this weekend, apparently a lot of my colleagues in the state were not, as well as the courts, of course, not being open, and I couldn't access information I was looking for. So I would like to basically continue this item to June 9th so that I really have substantive information to bring to the board.
The one concern that I'd have with that is the resolution that we just adopted requested a response from the governor's office by June 1st. If we don't receive a response from the governor's office by June 1st, might it not be necessary for our board maybe at the first, because I believe June 1st is, what day is that?
It's a Monday.
Is it a Monday? So to maybe consider a meeting at some point this week. So just continue the item as opposed to continue it to a date certain is kind of what I'm getting at.
We can do that, and then we can determine if there's a need to hold
That's what I'm saying. As opposed
special
to
meeting.
continuing this to a date certain, we just continue the item. Don't
Right.
specify that we're continuing it to the 9th, just say we're continuing.
That's
all
fine.
I'm saying.
All right, so with that, then we will adjourn to our next regular meeting, which is June 9th. Thank you, everyone, for the hard work and the time we put in.